anthropometry. So I think Dr. Anish is going to give you some practical tips on, if you can, Dr. Anish, summarize the whatever. Yeah.
This this is going to be a very short presentation because, as Vaishali rightly said, Dr. Amit has done a wonderful job of covering quite a lot of body fat analysis. Basically, the way I look at it now is that uh, we are seeing so many cases of obesity these days. We are seeing a lot of patients whose BMI is not very high, but they have quite a lot of adiposity. So it's important that those of us who want to explore this field of obesity should be uh, looking at things beyond just simple BMI. So that's where probably we have to go beyond the anthropometric measures. Just looking at BMI, waist circumference, waist hip ratio is good, but that probably is not enough. That's where probably we need to do start exploring things like DEXA scan and BI. These are tests which are very easily done, which are easily available. Something which is already covered in the morning. Basically, these are all the methods that are available for us to look at body composition, and there are problems and advantages of each method. For example, this particular method, the direct methods are something which are used more in the realm of research. We don't use them in clinical practice. What we use in clinical practice is essentially a DEXA scan, maybe some cases CT and MRI, and then obviously lots of anthropometry is what is actually used in clinical practice. So we'll just directly go to the DEXA scan part of it now. uh, this is again something which Dr. Amit has rightly told us in detail, that how do you position the patient for DEXA scan. This is something which is very important, because if you don't do positioning properly, when the patient comes back for a review report at a, say, let's say you have called the patient back after 6 months or a year, there'll be a lot of variation which are a little difficult to interpret. So the positioning is something which has to be done very, very properly. There are very clear-cut guidelines, which obviously any technician who's doing DEXA scan for this purpose would know, but that probably has to be supervised. Now, there are three or four things which we look when you see a DEXA report. The first thing which most of us, which is relevant to us, I'm talking with respect to people here who are not big time into looking at DEXA scan or BI reports. I would say non-endocrinologists. So what we're looking at, if you have to just look at 4 or 5 entities, the first thing to look at is the body fat, because we have already talked about this multiple times since morning. Anything more than 25% in a male, more than 30% in a female is significantly increased adiposity. So that's the first thing we look. You can see here the value is definitely on the higher side. The other thing we look at it is the android to gynoid ratio. Again, anything more than 1 in a male, more than 0.8 in a female is something which is significant. And the third thing we look at is what's called the visceral adipose tissue. Here we're looking at a number more than 100, essentially indicating that there is increased amount of visceral adiposity. That is adiposity which has a link with all the metabolic disorders we are talking about, whether you're talking about diabetes, whether you're talking about dyslipidemia, whether you're talking about MSLD, everything is connected to this visceral adiposity. Now, there's another thing which again Dr. Amit talked about in the morning, that is the fat metabolic index, something similar to body mass index, fat mass index. So here, so if you see here that just below the total fat, there is the entity called the fat mass index. Anything more than 6 in a male and more than 9 in a female is definitely significant. So you have a patient here whose BMI is normal, but his fat percentage is more, his fat mass index is more. So this is the classical case of normal weight obesity, which slowly the terminologies are changing. So essentially, this is a patient whose BMI is normal, so he appears normal, but he has increased adiposity. And again, this study which was done in Kerala found that almost one third of patients who had normal weight in that particular study had increased adiposity. Sarcopenic obesity is something which we endocrinologists are talking a lot these days. Essentially, if you look at these two images, this is somebody who has a normal, I would not say normal, the classical type of obesity, and this is a patient who has sarcopenic obesity. You can see here, there is excess amount of fat, the yellow component. And look at the muscles here and look at the muscles there. So there is loss of the muscle mass and excess amount of fat. So when you look at this patient, because of that excess fat, it appears that the patient looks normal, but actually the patient has decreased fat mass and increased BMI. That's the classical. There are criteria to say, diagnose hypopenic obesity, but I'm just trying to simplify it. So what we do here is that we look at the so this is how we diagnose it based on the SMI, or that is skeletal muscle index. With anything less than 7 in a male, less than 5.4 in a female, is something which is uh, suggestive of sarcopenia. So this is what I was talking about. Fat in this region, the android region, this is the you take ratio of this and the ratio of fat in the gynoid region, that is the glutofemoral region. And if this ratio is more than 1 in a male, more than 0.8 in the female, so obviously that is associated with increased amount of metabolic issues, diabetes, dyslipidemia, NFLD, and so on and so forth. So that's what we are looking at. And another entity which we look at is the visceral adipose tissue, which is again, as I said, more than 100 is what we are looking at as a danger zone. So to just sum it up, if we look at these 4 or 5 parameters in a DEXA report, we get a very good idea of what's happening. We look at the total fat. Just below that, we get the fat mass index. These are the cutoffs in Indian patients. We look at the android to gynoid ratio and the visceral fat area. If you look at these 4 entities, you have a fairly good idea of what's happening to your patient. So that's how we look at the report of a DEXA scan. Now, as far as bioelectric impedance is concerned, this is again something which Amit showed in the morning. This is from a machine called InBody, which is very commonly used. There are a lot of machines, but almost the pattern may be a little different, but the information is more or less similar in different machines. So that is the basic data. What you're looking at is 4 or 5 things: body composition analysis, muscle fat analysis, obesity analysis, a segmental lean and fat analysis, and then how it has changed over a period of time for that particular patient. If you have done multiple BIs for this patient, let's say you start him on a GLP-1 analog and you see a change. Now, the advantage of using a BIA is that it can be done in your clinic, one. Now, let's say that you have started a GLP-1 analog in a patient who is overweight or obese. I would not say overweight, obese, because you're not going to start for an overweight patient. You will start only for an obese patient, because the BMI cutoffs to start GLP-1 analogs are very, very clear. So you started in a patient like that. The patient comes to you that, sir, I've been taking it for 3 months or 4 months, but I'm not seeing much change in my weight. If you have something like a BIA, you can show him that, okay, you're not lost so much of weight, but there is definite reduction of reduction of fat. And I'm sure if you see, the reduction in the visceral component is going to be much more than the overall fat reduction. So that's something which is very reassuring to the patient, that yes, this drug is acting. I am losing weight. I'm not losing weight, but at least my fat portion is coming under control. Now, just show you a few things which a little more in detail. So obesity analysis is something which is very simple to see. So this patient, the BMI is 23.9, but if you look at the fat component, it is definitely on the higher side, 43, almost 44%. And we already talked about it. Anything more than 25 in a male, more than 30 in a female is high. So you have a patient here whose BMI looks normal, but his body fat is more. So this is the classic example of normal weight or a thin fat obesity, whatever you want to label it as. The other thing which we look from the DEXA is the visceral fat area. Again, something similar to visceral adipose tissue in a DEXA scan. Anything more than 100 is associated with various metabolic complications. We can also assess sarcopenia. So as I was mentioning, so essentially what happens is that because of the total body weight, which is predominantly adipose tissue, the patient looks to have normal BMI, but there is significant muscle loss in these patients. And we also know that, in a postprandial state, the muscle is a major site of disposal of glucose. So somebody who has significant sarcopenia would have issues with uh, blood glucose control as well. Now, what we look at here is an entity called SMI, that is skeletal muscle index. And if this SMI is less than 7 in a men, less than 5.7 in a women, then you are dealing with sarcopenia. Now, there is another very closely associated analysis that we do in BIA. This is called the muscle fat analysis. So here, what we do is, if you see here, this is where the muscle fat. So same thing I have enlarged. So this patient, you're looking at 3 entities: muscle, total skeletal mass, and the body fat mass. So you look at these 3 things and you draw a curve. So if you join the ends, if you get a straight line, something like this in the normal range, this is an ideal situation where patient has a balanced body, normal and healthy. If you have a pattern like this, where the weight is more, the skeletal mass is less, but the body fat is more, a C-shaped kind of a pattern. So the mnemonic there is cautionary. So you are dealing with the sarcopenic obesity in this patient. So this is a visual impression which is easily seen. And if you see a patient like this, where the weight is kind of okay, the skeletal mass is on the higher side, and the body fat is on the lower side. So it's D. So this patient is quite well developed. I mean, the muscular structure is very well developed. He's quite athletic. So what we are looking at is this. So when you look at DEXA scan, the first thing you would look at is the body fat percentage. I mean, I'm talking about simplified way of looking. The second thing you look at is the SMI, the skeletal muscle index, which will give you idea about sarcopenia. And this is another thing you can look at, muscle fat analysis, which will give you the same kind of idea whether you're dealing with sarcopenic obesity. And the best part about this is that if you're monitoring this patient over a period of time, you can get a graph which gives you an idea that, okay, the weight's coming down, the body fat is coming down. But here you can see there is slight reduction even in the skeletal muscle mass. That's something which we see when you put a patient on GLP-1 analog. So as far as BI interpretation is concerned, if you look at 2-3 things, the obesity analysis, looking at the percentage of body fat, looking at the muscle fat analysis, what kind of pattern you have, whether I, D or C, that's something which will give you a fair idea of what's happening. And when this patient comes back, the same things can be compared again. So uh, if you're looking, so if you have to talk about obesity, you're talking about maybe 3 phenotypes. One is a patient who has predominantly visceral adiposity, metabolically unhealthy person, somebody who has sarcopenic obesity and metabolically healthy. This is an entity which is very controversial at this point of time. Just for the sake of completion, I've listed it here. So this is a patient who has predominant defect is increased visceral adiposity, and you're going to look at these tests, waist circumference, DEXA, BI, to get an idea about visceral adiposity. In this patient, the predominant approach would be to put this patient on a calorie deficit. So you reduce the dietary intake, you increase the exercise component, and there's a very strong role for GLP-1 analogs in these patients. But when you're dealing with this entity, sarcopenic obesity, where the patient has excess adiposity, but there is there is also increased amount of myostatosis, essentially deposit excess fat in the muscles as well, but overall lean body mass is less. Now this patient has a problem where there is loss of muscle mass with excess muscle fat and fat all over the body. The optimum test would be, there is something called a questionnaire called the SARCF, which can be done in the clinic. And again, your BI DEXA will give an idea. Here, the approach is different. Here, the first approach is to increase protein intake of this patient and to encourage patients to go on a resistance exercise. Now, if a patient has sarcopenic obesity and you put them on a GLP-1 analog, you are going to aggravate the problem because there will be loss of adipose tissue, but the patient will also lose significant amount of muscles. So these are the patients who probably need to be addressed in a different manner. That's why a body composition analysis becomes so important. And obviously, somebody who's metabolically healthy, there is no primary defect as such, but the patients would be encouraged to go on a lifestyle modification to lose weight, because you have to tell the patient that, okay, at this point of time, your BMI is, let's say, 26, but you're still on the obese side and you need to lose weight before you start developing any complications because of obesity. So if you have to sum it up, most of us, if you're looking at this graph, things like BMI, waist circumference, BIA, that is bioimpedance, is something which is very accessible, which is scalable, easily done. So this will probably be very useful at a population level screening, at a clinic level, to look at large number of patients at a low cost. But if you're looking at some research kind of a setting, probably you will look at more specific modules like MRI, CT scan, and things like that. DEXA scan will come somewhere in the middle here. At this point of time, it's kind of a gold standard when it comes to a body composition analysis, because it's something which is easily doable, but obviously the cost part is little more than BIA or the normal anthropometry. So this is where your body composition tests would lie in this particular graph. Just to sum it up, when you see a patient for the first time, maybe things like BMI, waist circumference are good thing to start with. The second phase would be to use DEXA or maybe BI to look at the body composition. And then the third phase will be to look at the lean mass, the patient, what is the sarcopenia, whether the patient has it or not. And probably this is something which we will not do in a routine clinical practice. So this is the steps that are involved in analyzing a patient from a body composition point of view. So with that, I come to the end of my short talk. Thanks a lot for patient hearing. Um, I hope I covered it fast.
CT at the abdominal cuts, the CT cuts which show visceral adiposity. So does that help in differentiating between subcutaneous?
Yes, it can help. It can be used. You can see that on the CT scan. Yes, it can help. But then you are not going to do a CT scan because of the radiation exposure, right? You cannot do it as a routine. The amount of exposure in a DEXA scan is very small. It is less than the background radiation that most of us would be getting it. So DEXA is much more safer. And if you have to redo it again and again, maybe once in a year or once in 6 months, it's something which is doable. You can't do CT scan again and again because the radiation exposure is going to be very high.
What is the role of regional fat, like epicardial fat or liver
Yes.
fat?
So for regional fat, you have to have a dedicated MRI or CT. This thing. Uh, the general concept now is that whenever there is a spillover from the subcutaneous tissue, when the adipose tissue overwhelms the storage capacity of subcutaneous tissue and spills over to all these ectopic sites, there would be dysfunction there. For example, epicardial fat uh, has been associated with increased risk of cardiovascular disease, basically because the coronaries run on the surface. So if there's a fat deposition around the coronaries, there'll be a lot of cytokines which are released locally. So they call it insult from outside. So you are locally attacking. These adipocytokines are kind of harming the artery, so that will accelerate the process of atherosclerosis. Similarly, liver fat would increase insulin resistance at the level of liver, increase glucose output. Pancreatic fat would increase the beta cell dysfunction. So when you lose weight, the reverse happens and diabetes goes in remission.
Sir, it's regarding the BI technique that we use. How much error you expect in the measurement of this fat levels? Means whether there is a kind of 3% error or 5% error.
I think compared to DEXA scan, there is a little. The DEXA is more precise. BI has about 4 to 5% error, but repeat measurements, I'm not sure. Amit, how much is the intra coefficient? Because I'm not sure about that. If you do it again, this thing.
At present, there is 96% accuracy. Is that seen
Just
with
about
DEXA.
4% variation is there.
And-
BI.
Yeah, as compared to DEXA.
Yeah.
And it is said that basically if you do BI first time, same machine to be used, ideally, same technician to be used, and that has to be ideally followed. That is it.
In fact, that holds good even when you're doing DEXA scan for osteoporosis also. We always insist that you go to the same center and do it, because if the technician also changes there also, because the positioning, all those things make a lot of difference. That holds good, absolutely good.
So I had a question.
Yeah.
Please.
So I want to ask both of you, sir. Also mentioned about this smartphone app that is you can take a picture and you can tell the fat percentages and all. Like that is available in China or it's available in India also?
I don't
It
know
is so far, the studies have come from China.
China.
Basically.
And like many gyms and all, like patients come to us with reports and they say, "Hamara BMR itna hai, hamara fat itna hai." Meaning,
a lot of gyms have a BI machine.
they're using BI, no?
Yes,
sir?
yes.
But then again, the accuracy, like you're saying, the technician should be the same to do the BI every time.
No, BI is
It's easy to do.
easy
Don't
to
need a
do.
technician or anything.
No, but
yeah.
those things make a difference. I think Dr. Amit gave you a list of all those do's and don'ts. Like, I think there's some 7-8 do's and don'ts: when to eat food, how when to have alcohol, and all those things. Those things make a lot of difference. So I'm sure a lab wouldn't, a gym person would be not aware of all those things. So that is something you have to take with a pinch of salt.
But most are using in-body mostly.
Yes, InBody is the
only,
most
yeah.
popular BI machine.
Yes.
So
And
we have
basically
to-
the lab, basically gyms, etc., have got lower variants. So you only get fat analysis. If you go to higher ends like InBody 770, etc., it's more of the research grade. So you got more segmental analysis with that basically.
So
So
because
mainly in the institutes they are following that.
Lower variance meaning the in-body lower.
InBody, say it is 120 InBody. So the
Okay.
cost comes around 2 lakhs.
Acha.
But if you go higher variant, 770 or 970, it comes in 18 lakhs, 20 lakhs machine.
Okay.
And they have got more detailed analysis.
okay.
Agree.
And they and one point, they also give one point called as phase angle, if anybody knows. It gives cellular integrity. So higher the phase angle, it indicates the cell mass is high and it is good for metabolic health. So that is also is not available in the lower variants.
And this BMR that like they'll quote, we have this BMR, we were told it was low BMR. Like till now, I don't comment on it when patients ask, but how do they get the BMR calculated from these values?
I think that is something which is not done using a BI machine, because bioimpedance doesn't talk about BMR. At least I'm not aware of it.
Okay. DEXA probably, I think so you can measure.
No, it doesn't
you can't
measure
measure.
BMR.
And sir, one more thing, whether we are using the equations for calculation of this BIA by BIA technique, are they relevant for the Indian population? Because there can be a difference, racial differences, even in the equations that we use. Because that is what the problem we have faced when we have used different kind of BI machines. So these machines come with different equations.
Yes, definitely. Sir can also agree. There are certain, as I mentioned in the morning talk, certain equations which are free to use, and certain are copyrighted.
Generalized equations are
So-
okay.
So they are different as per manufacturers, but yes, definitely, as compared to Western population, it may be different to us because studies are less with our population.
So we do have any kind of studies where we have compared BIA with DEXA in Indian population?
Indian population, I'm not aware of it. I mean, I'm not there. Comparative studies,
Comparative.
DEXA,
They have done
DEXA
unofficially.
is the
Small
gold
numbers.
standard. If you
Small
have
numbers.
to go, it is DEXA. BIA has lot of errors.
about 4% error is there, man, approximately 4 to
But
5%.
if you have to give repeated kind of measurement, BIA
Then
is
DEXA.
usually used.
Yeah.
So if we have a data that how much difference and whatever the BI is calculating is almost same or similar to the DEXA, that means the equations that are being used in BIA, they are giving you as good as result as that of the DEXA.
It is
Ma'am, it's
not
just-
as equivalent with DEXA.
Ma'am, it's about 4% error.
Yeah.
If you're using the same machine, let's say you've done 4 times BI over the period of 1 year, 1.5 years, you're doing it on the same machine, right?
Yes.
So I think that whatever change is occurring, so if your initial fat percentage was 40%, it's come down to 35%. That indicates it's fairly okay. I mean, I think you can rely on that because it's on the same machine. But the issue here is that all those things, you should not, patient should not do it immediately after eating food, because all those things are very important, which an average gym person will not know. If you should implement in your clinic. For example, I'll give you one more thing. For example, we do fibroscan for MSLD, okay, fatty liver. Now, initially when we started doing fatty fibroscans, we were getting very high values of LSM. Okay, so which indicates liver stiffness. And then we went on we read that if somebody has eaten food, there is increased amount of portal circulation and that will increase the liver stiffness. So you should not do it immediately after eating food. So these are small things which you learn once you start doing it. If you don't do it, you'll not know those subtleties. So that's how it is. So whenever when we do a fibroscan for a patient, we tell them very clearly you need to be on empty stomach for at least 4 to 5 hours. That's how we do it. So that factor is removed. The same thing holds good here also. All those do's and don'ts are very important.
Thank you.
So thank you, Dr. Anish, and I think this was a very good discussion with Dr. Amit and Dr. Anish, explaining in depth about the importance of analysis of body fat. Of course, our current status of guidelines believes more into the clinical aspect of measurement of fat in terms of the markers of insulin resistance and so on and so forth. So now I hand over to Dr. Phadke sir for explaining. This is the workshop part of the day. So I think we've had a very loaded morning session. So I'm sure that infotainment, yes, sir. But anyways, the purpose of this workshop is to understand that we need to know how the mind functions in a normal human being, to understand how the mind functions in an abnormal or a obese human being. So I think let me have this pleasure of introducing sir once again. Sir is a senior neuropsychiatrist at Jahangir Hospital and Deenanath Mangeshkar Hospital. He's the chair of Behavioral Medicine, Center for Behavioral Medicine, and he's also the chair of the Task Force of Mind Body Medicine by the Indian Psychiatry Society. He has a huge professional research career of 3 decades, and he mainly has been functioning into the neuroscience of yoga and he has an Indo-German collaboration in this. He's been a part of the integrative health panelist of the Viber Summit called upon by the Prime Minister's office, and he's been part of many research protocols, including the earthquake at Usmanabad, Killari, no? Killari. Over to you, sir.
Good afternoon. Hope you have had a very fulfilling lunch. You had? Good. This table? Good. This table? Good lunch. This table? Good. Why is your table so empty? Good. Changla? Good lunch? Good. Good lunch? Excellent. झालं दोगळेकर साहेब चांगलं जेवण केलं चला बरं So after the good food, this is the best time to do some interesting activity. I can see some, of course, familiar faces who have attended these workshops before. So I think they know about the nature of this activity. Some of you may be new to this activity. The idea is simple. As we have been listening to various experts last 2 days, there is perhaps one realization for everyone, and that is a realization mainly by the modern neuroscience, that inner awareness is a very important part in managing any health situation, and obesity is no exception. Inner awareness, like the way we have awareness of the external world, our whole body comes laced with, you can say, millions and millions of sensors. And we have this extraordinary capability to feel our bodies. We can feel our muscles. We can feel our internal organs also. Inner perception or introspection. We can listen to our thoughts. We can observe our thoughts. Modern neuroscience calls it that metacognition. And we can also listen to our emotions. We can listen to our memories. I'm sure once in a while we all do that, So we have these good abilities which people by and large put under the rubric of mindfulness. Introspection, metacognition, all these things put together, they are part of the mindfulness. And it has been demonstrated, there were a lot of presentation speakers from the psychiatry and neurology side who tried to tell you, that lot of problems and issues, they are present there in the brain also when we talk of obesity. And there is a lot of research, that many people with various health issues, including obesity, as I said, they suffer from this problem that they do not get a sufficient feedback, from their inner organs. Many research studies, elegant recent research studies, they have demonstrated that how people in obesity, they suffer from this problem of introspection and the other components of mindfulness. But when mindfulness comes to our mind, one wonders, whether one need to do a long course of meditation, 10-day course, sit in silence, observe your body, observe your breathing, or 5-day course, or whether it is possible in a real quick short span, and particularly like when it comes to the patients, can they really be taught in this skill of inner awareness, because for our treatments to succeed, for our dietary regimes to succeed, for our exercise regimes to succeed, for other lifestyle measures to succeed, it is always helpful, if that patients are in touch with their own self, then it is very helpful. So we therefore have this special infotainment exercise, information come entertainment exercise, which helps enhancement of inner awareness. Of course, a lot of neuroscience research went into that, and which is like a sure way, you can say a shortcut, to a 10-day course, a 10-minute course in mindfulness, we call it. So I will put out some instructions here on the screen, okay? And we all will go as per those instructions. Okay? You have to follow. All we have to do is we just need to follow, these instructions. We can do it, of course, in a very relaxed and leisurely way. Okay, so what is the instruction here? Instruction काय? Anybody loud? एक दोन माइक आणून द्या यार, एक काय? Yeah.
Yeah. Listen to the music, which will help you to sleep.
Exactly. So exactly. Good. सबको समझ में आ गया क्या भाई? सबकी आईज क्लोज है ना कि ओपन है? देख लिया ना, इधर लिखा है प्लीज क्लोज योर आईज and listen to your music. Okay, so you tell your brain this, what the brain is supposed to do. Okay, so I will play some music for you. You close your eyes and you listen to the music. Very simple. Okay, so please close your eyes. So you can open your eyes now, and I will pass on the mic to you people so that you can narrate about your experience when you are listening to this music. Hmm. So, who would like to go first? Who would like to go first? This table? So, there is actually a competition, that which table can narrate more experiences, what your mind was thinking, feeling, seeing. Yeah, you like to speak? Go ahead.
Yeah, it was wonderful and very. Yeah, it's working. Yeah, chal raha hai. It was wonderful. Actually saw Amir Khan dancing in tea gardens with flowing waterfalls. It was refreshing experience. Thank you.
So you have seen Amir Khan.
Yeah.
Good. So you have this good ability. You don't need even a Netflix. You can see Amir Khan at will. Great ability. That's why Netflix is going in for a loss. If everyone starts doing this. Yes. Yes, बोलिए मैडम. हाँ ये लीजिए. चलने वाला माइक लीजिए.
So yesterday, which sir was it? He was telling that, Rao sir, that women have no imagination. So play this song and imagination will start. So मैंने तो ये इमेजिन किया कि भाई जब भी मुझे झगड़ा करने का मन करता है मैं ये गाना अपने मन में गुनगुनाऊंगी तो झगड़ा ख़त्म हो जाएगा and I will go back in that phase of my life when I first met this person and I fell in love with him.
Which person you are talking about?
That is not to be that is not necessarily to be revealed to you, no. The point is I go back to that experience and I get out of the anger that I'm in. So it's a very good recreational activity and also reframe. Brain science wants reframe, no. So I thought I can use it in that way.
कैमरा है ना एक बार लोकल नहीं दिखा रहा है वो चड्डा सर को मुंबई में भी दिख रहा है उधर
हाँ तो चलेगा, no problem. I think he should also use this song.
वो कर ही रहा है उधर यूज
वो किसी और पे कर रहे होंगे मैं भी किसी और पे कर रही हूँ. Thank you sir.
थैंक यू. कौन बताएगा और यार? यू लाइक टू स्पीक मैडम? बोलिए. या यू हैव माइक. या आराम से बोलिए.
I felt a bit of sleepy in between.
Good.
Yeah. And it was refreshing moment, right?
Anish?
But a little bit of sleepy. It was like I was feeling a bit of drowsy also. Like
Yes.
yeah.
Anish, she took your hypnotic suggestion. Anish is also amateur hypnotist. आपको पता नहीं क्या हो? He gave you a hypnotic suggestion. It perfectly went into your head that when you listen to music, you will go to sleep.
If you had played it for another 5 minutes, I would have slept. It was definitely, another 5 minutes I would have slept off. It was very relaxing.
Very relaxing यार. चलो अच्छा है यार सर को यार. Yes यार. Very good यार. आप मैडम आप. Yes मैडम बोलिए.
So it reminded me of Amir Khan first, but then it took me to the hills, to my childhood, where I spent my life in boarding school in Nainital, because the same kind of scenario that Amir Khan was dancing around in this song. I saw the pine needles very clearly around me. I saw the very clear blue sky, okay, and all that, those places around my hostel.
Imaginary हुआ या नहीं?
Yes.
नहीं पर वो अनिश समझ गया कि it is Amir first.
There is a message. Amir first. नहीं चलेगा मैडम बोलिए ना आप.
आप बताइए फिर मैं आपको चंडीगढ़ का किस्सा बताता हूँ. बताइए पहले. आप बताइए पहले देहरादून का किस्सा बताइए. फिर मैं आपको हमने चंडीगढ़ में वर्कशॉप किया था वहाँ.
Actually, lyrics are like that. No? So I went back to my college romance. And I also saw my son also playing with him. That was like Two things I've seen.
So this music is very, very relaxing, first of all. And it took me back. I was in 10th standard when this movie released, and I distinctly remember. So yes, American. I felt like I am American many times, and I also saw Pooja Bedi. But what more importantly, I saw Pooja Bedi because she enters in this song. I'm not going anywhere else. But what it took me to is those days of we were life was a little carefree, a little went a very long way. The needs were few, the satisfaction was high. Today it's the exact opposite. Where म्हणजे खूप कमी याच्यामध्ये आपण खूप खुश होतो अगोदर. हो हो अगदी म्हणजे आजचं सिनारिओ मी बघेन तर आज भरपूर काही आहे देवाच्या दयेने पण कुठेतरी एक ते सॅटिस्फॅक्शन जे म्हणतो ते थोडंसं संपत नाही आपलं सो नाउ सर यू आर पुलिंग माय लेग
ऐसा बोल रहा है ना यार, आई एम जस्ट रिप्रेजेंटिंग व्हाट यू सेड कि पुराना जमाना कितना अच्छा था, गुड ओल्ड डेज नहीं का, थोड़ा पूजा बेदी को देख लिया काम खत्म नहीं का, चलो बोल पायल, बोल यार बोल.
So what I saw was a piano in a black and white, and hands were playing those piano, and it was very like a Bollywood kind of music background. And suddenly I saw in colors waterfall, and I could see those droplets falling like a mist in waterfall in all colors, and again went back to black and white picture. So yeah, it was very nice.
ठीक है मी पण बोलते ओके so first of all I saw hands few fingers playing piano as well and later on I saw myself dancing and then after that and even Payal was with me Payal Mani ma'am तुम्ही पण आणि लीना ma'am as well we all were dancing then Vaishali ma'am joined us then I happened to laugh ki काय चाललंय yes and later on I saw myself sitting in my balcony in the plants and all and I was sipping in tea and it was so refreshing. I felt so refreshing and I felt okay now next time I should take out some time and have a cup of tea in my balcony in the garden and should listen to this music again to enjoy this moment again. Thank you.
नहीं चांगलं यार, लेडीज पार्टी इज अ गुड आयडिया. टोटली विथ यू,
Everybody of us are dancing.
नो प्रॉब्लेम.
Madam,
नहीं नो प्रॉब्लेम यार ना कोणाला these people.
I'm not the doctor, sorry, but yeah. I was just remembering my unemployed days. Today I am as in freshers and a management trainee, but during my Naipur Hyderabad days, I'm just remembering that how careless I was, only focusing on my academics and extracurriculars like dancing, singing, and all that. And today, as an employed person, there's a lot of pressure, I guess. There's a lot of things, responsibilities around me. So this song was really refreshing, relaxing for me right now.
Took you back to your days when you had time to listen to music. अच्छा यार, good यार. You want to say something, sir? You are not there. You want to say something?
Yeah, you started that before song, looking inside. So that was in my mind. So song, definitely we felt that Amir Khan and all those things, they are outside. Then I started looking inside. Then gradually the music was going on, soft, relaxing, but I was inside my house. Body I call my house. What's happening here? Oh, too much food. overworking liver, enzymes, organs. Being doctor, I identified all organs. Muscles relaxed, not working now. Let them do the loading and unloading. Later on, we will come and become active. बाद में म्यूजिक बंद हो गया.
Very nice. Yes.
To be very frank, for a moment, yeah, for a moment, I got totally disconnected from the stressful part and entered totally in the calmful zone.
Okay.
That was very relaxing kind of.
Okay. So you have felt relaxation while listening to music. Okay. Anybody else who has have
Anyone else
want
who
to
would
share?
like to share, speak?
Anybody who would like to share, speak?
वैशाली मैडम से भी पूछ लो.
वैशाली
वाणी
मैडम?
मैडम से, वैशाली मैडम से ही पूछ लो यार. वैशाली मैडम बोले कि मैं पूछा नहीं तो.
Me, I was thinking that whether I should lie down on that sofa. It is more relaxing to just lie down and listen rather than, because I was really feeling very relaxed. Actually, I just closed my eyes and then later on I thought now everybody should wake up early. That is what. Nothing more.
Good. Vaani, you like to speak?
So I also felt. I mean, I expected that it'll be a good music and all. So I was looking forward to listening to the music. And then I was thinking of my husband, and then I remembered whether he's instructed the maid to do the evening cooking or not. And throughout the song, I was telling myself that immediately as the song ends, I have to message him and check. Immediately as the song ends, I have to message him and check. So that was what I was, but I felt overall very relaxed.
Very good. So what do you think? I'm sure that it was not the first time that you happened to listen to this music. It's a very old music, isn't it? It has been there, as the Gen Z would call, for ages. Retro music.
Retro music.
It's a retro music. So many years ago, this music came in. I'm sure you must have listened to it many times. And now all of you got to listen to all the people. People had spectrum of experiences, imagery, some thoughts, some memories, some imageries. What do you think is happening here? From a brain science viewpoint, what do you think is happening here?
What was the instruction? Listen to, close your eyes and listen to music.
As Joshi sir said, he followed the instruction. Close your eyes, focus on your inner world. So then he was looking at his muscles. Then he also had a guilty thought that maybe he has eaten too much. That is straining his liver. But point is that the instruction was close your eyes and listen to your
music.
Listen to the music. Did you think that your brain did only that, or did lot of extra things?
Many extra.
So speak, yes sir. Boliye.
There should be thoughtless awareness. Instead of that, the thoughts are flowing.
Not only thoughts are flowing, memories are flowing, imagery is flowing, emotions are flowing, everything is flowing. Why does this happen? Or why did it happen? What is your guess? So simple instruction, as he said, maybe we could have followed this task, or every day we live, in this illusion that we follow some simple things. So you saw here, isn't it? A simple thought, so many things it triggered. What do you think, maybe the reason behind that? By, whatever your understanding, whatever common sense understanding you have of the way our brain or the mind works. What do you think, is happening here?
Link of this music in our memory.
Mm-hmm.
How it is linked in our memory.
Link is triggering some kind of memories.
Yes. Link is triggering
Emotions.
something.
Feelings. Association.
So, do you think that we often have a belief, as adults, we all have a belief that my mind is under my control? Do you think that in this situation, you really controlled your mind and listened actually to the instruction, or the mind acted on its own? Do you think mind acted on its own? काय वाटतं तुम्हाला? Mind acted, yeah, on own. Does the mind always act on?
But I honestly feel listening to this from you that our signal to noise ratio is very, very skewed, and we need to check that first.
सर सादी भाषा में बताओ यार.
Sir, the signal is the instruction. Our signal is the instruction. Close your eyes and listen to the music. The noise is inside our head, which gets associated with that particular kind of an event, maybe.
You're right, yaar. You should have an honorary degree in neuroscience, nahi ka, Jawalekar sir. So you're absolutely right. This experiment basically tells us, why is this experiment there? As we said, it's an infotainment. On one hand, it's an entertaining music, but it tells us something very profound about us. What it tells us is that there is a lot of spontaneous activity in our brain or mind, whatever you want to call it. And it also tells us that this time, because you are given the instruction to be mindful of it, that's why you are able to see it. Our mind is unnecessarily processing, all that stuff which is obviously not required all the time. We are just not aware of it, okay? What is the amount of energy that the brain consumes? What is your idea? What is the weight of a normal brain in a person?
1000 to 1200 grams.
1 kilo vajan, brain, human brain in an adult, she says is about 1 kilo. Average, maybe some gifted people have less, more. 1 kilo, brain is 1 kilo. So for a 1 kilo brain in a 60 kilogram person, how much energy does the brain consume? कितना energy consume करता है brain? What is your?
नहीं मैडम 100% तो नहीं जाएगा क्योंकि बाकी भी टिश्यूज है.
20 to 25%, yes. Yes. So the scientific question to people is, obesity reduction के लिए किसी ने अभी try नहीं किया है, पर brain को ऐसा ही music चला चला के, can you consume more energy? Is it possible? I am throwing open a very wild question to you, in this infotainment program. If the brain consumes so much energy, why strain your muscles? Someone can say कि brain को बहुत चला लूँगा यार. Muscle से कितनी energy आती है सर? Muscle को चलाने से? हाँ? तो 1 घंटा brisk चलना versus actually दिमाग को ज़्यादा चलाना. What do you think is? दिमाग चलाना ज़्यादा आसान है. तो नेक्स्ट साइंटिफिक क्वेश्चन ये है कि ज़्यादा दिमाग चला के लोग पतले होते हैं या दुबले होते हैं?
मोटे होते हैं. पतले या मोटे?
पतले या मोटे होते हैं?
बोलिए.
दोनों हो सकते हैं. So in depression they tend to lose more weight because they are having a very high BMR and the calories burned down are more, and otherwise they overeat also, so they can become obese also in that sense. Both ways.
Anybody else would like to give, because it's an open forum. Anybody can give their opinion.
आपको people have been talking here नहीं का about amygdala, about the brain structures नहीं का न्यूरोलॉजिस्ट और बाकी सब लोग आज वो कार्डियोलॉजिस्ट ने भी बताया इवन नहीं का कि ह्यूमन ब्रेन में लिम्बिक सिस्टम, एमिगडेला नहीं का इसका सबका रोल है ओबेसिटी में। तो आपको क्या लगता है कि अपना ये जो ब्रेन है ये हमेशा ऐसा ओवरवर्क करते रहता है क्या? ब्रेन ऑलवेज ओवरवर्क करता है? ओके, स्लीप में नहीं करता है।
It works during sleep as well. Not overwork or anything, but it works even during sleep.
It depends on what type of sleep.
So if you're not having that deep sleep, REM sleep, and you're still thinking मेरा कल presentation है, मेरा कल तैयारी नहीं हुआ है, कल खाना क्या बनेगा, तो फिर वो sleep नहीं होता है ना. That time the brain is again working. How much it is working, I don't know, but that is the truth. Then you get up in the morning and then you see the time इतना बज गया है अभी, and that is overwork. Obesity में नींद मस्त आता है.
मस्त आता है? Yes.
It depends, no, again.
यानी ऑप्टिमम नहीं रहता है. It could be on a higher side or
But obese people have disturbed sleep. Like they don't sleep. If it's not the number of hours only, quality of sleep is not good.
not good.
Not just due to obesity, not just due to physical characteristics. Just overall, एक triad which I see, gut issues, sleep issues, obesity. It will always go together.
तो obesity में, if we have to conclude, obesity में brain overactive रहता है या underactive रहता है?
Overactive. I mean, overtly. This very not like only obesity, but I think the entire population is overthinking. सिर्फ obesity को नहीं बोल सकते.
चलो यार, शर्मा ने फाइनली सारे प्लानर्स के लिए सत्य बता दिया ना क्या? प्लानर्स यही पूछ रहे हैं भारत में ओबेसिटी क्यों बढ़ रही है, क्योंकि लोग बहुत सोच रहे हैं भारत में क्या? तो ये अभी का प्रोडक्टिव थिंकिंग था क्या? आमिर खान ने क्या फाइनली, है ना? तो सोचने वाली बात है ये, है ना? बट द लिमिटेड पॉइंट इज दैट वी हैव दिस इल्यूजन, यू नो, दैट कि ब्रेन में जो एक्टिविटी चलती है अपन उसके बारे में अवेयर हैं, यू नो, दैट आई एम अवेयर ऑफ व्हाट एक्टिविटी हैपन्स इन माय ब्रेन. इट्स ओनली एन इल्यूजन, यू नो, दैट इज ओनली द टिप ऑफ द आइसबर्ग. Neuroscience guys, in recent times, last year, very interesting article people published. For some years they were trying to compute, you know, how much data is given. अभी data का जमाना है ना, data science, we live in the times of data. So people computed, you know, कि actually कि कितना data generate करती है body के सारे sensors. तो कितना data generate होता होगा body में, क्या अंदाज़ है आपका? जोगड़ेकर सर को पता होगा यार, signal and noise नहीं का, उसको पता रहेगा. यस, 1 बिलियन बिट्स पर सेकंड. और उसमें से अपना अवेयरनेस में कितना जाता है इंफॉर्मेशन? 10 बिट्स.
Exactly.
So we are aware of very small portion of what actually goes on in our brain. Okay. The moment, you know, you are aware of it, you are able to see it, you know, that what is happening in your brain. Similar way, when a person is aware of the body, you can see, you know, what is happening. It is almost like this camera. You know, our mind is like this whole room, the body is like this whole room. But at one point of time, the camera cannot see everything. Wherever you will take this camera, you will be able to see it. Okay. Inner awareness. Now we started by talking about the inner awareness or the introspection, mindfulness. So this is the mindfulness is, you know, that just now with the help of the song, you were able to become mindful. You become aware, you know, as to what is happening inside your head. You can, of course, you know, become aware what is happening inside your body also. And as I said that it is increasingly mapped that the non-awareness of the body and the brain activity is one of the features in obesity. Even if they want, patients, it is not easy, for them to become kind of very easily mindful. You are, of course, very mindful people. Let us now try to listen to another music. Okay, we will have another experience.
So, in application to obesity, this inner awareness is very important, because what we see is that most of our obese patients are not able to sense hunger. They don't know what is it like feeling hungry. So, hunger pangs त्यांना कळत नाही. So, why this is important, this exercise, it tells you that you have to be aware of your inner sensations. Like Dr. Joshi said, he could feel his muscles, he could feel that his stomach is heavy. That kind of awareness is lacking in most of the obese people, and especially in children with obesity. So they don't know where to stop, where the hunger ends and where they have to stop with that particular food weight is not known. So these are exercises for inner awareness which help in creating these kind of sensations of hunger, satiety, fullness, halfness, warmth. All these sensations can be developed with the use of these neuropsychiatric techniques, and that has a very important role in sensation development in obesity. You must be wondering why Amir Khan is there in an obesity conference. That's why I thought I'll tell you the answer to this.
Good. So the take-home message is that an untrained brain looks at Amir Khan, and the trained brain looks at, whether I have appetite, whether I have hunger, whether I have fullness, whether I am tired, whether I am active. Okay, fine. But we have this facility, and you saw, that in 5 minutes it is possible to be completely mindful. You don't really need to do a 10-day workshop, to learn mindfulness. Let us play another music. So this time what you do is, you compare to the first music experience, what happened this time. Okay, don't try to control your experience. Okay, let the mind do whatever it is wanting to do. Mind anyway does activities outside of our awareness. नहीं क्या हिंदी आती है सबको ना? हाँ, तो हिंदी में वो पता है आपको ना, सबको टर्म कॉल्ड एज मनमानी. क्या है? व्हाट इज मनमानी? Yes. So this is the biggest hurdle, in the so-called adherence of. नहीं क्या अभी बोला था ना किसी स्पीकर ने कि what is the main barrier in the so-called lifestyle management? The main barrier in lifestyle management कि मन अपनी मनमानी करता है ना. You may give it hundreds of instructions. ऐसा कर, वैसा कर, this is good, that is good, this is bad, that is bad. But in the end मन अपना जो है वो मनमानी करता है. It does, what it wants to do. Okay. तो लोग बोलते हैं ना यार पोएटिकली कि हर एडल्ट में भी एक चाइल्ड होता है. तो दिस इज द चाइल्ड इन ऑल ऑफ अस कि वो आप सुनता नहीं है किसी का, तो अपने को उसको नहीं क्या. मैडम ने कल एक सेशन रखा है कि वो चाइल्ड को डिसिप्लिनिंग कैसे करना, जिसको टेक्निकल भाषा में रेगुलेशन बोलते हैं. नहीं क्या, दैट हाउ टू रेगुलेट माइंड. माइंड नीड सर्टन रेगुलेशन, हाउ टू रेगुलेट द माइंड. और उसके पहले ना लेट अस लिसन टू अनदर म्यूजिक. ओके.
Meine Damen und Herren, ein Applaus für Karin Leitner.
This time the mind seems to have gone into a silence. कैसे था? How was this different from the first one?
फर्स्ट ऑफ ऑल रोज, जैक, पानी, डेक सब देखा, फिर माइंड में इंस्ट्रक्शन दिया ये सब नहीं देखना है, म्यूजिक सुनना है। फिर सब चला गया, म्यूजिक सुना। फिर थॉट आ गया कि अब पूछने आएंगे तो क्या बोलना है। फिर चल जाने दो, म्यूजिक सुनना है।
लाइफस्टाइल फॉलो करना है,
तो इस बार कंफ्यूजन
फॉलो
हो
अप
गया।
तो हो रही नहीं लाइफस्टाइल। अब मैडम के पास फॉलो अप को जाऊंगा, उससे अच्छा है फॉलो अप को ही नहीं जाता हूँ। नहीं क्या, वो बोलेंगे कितना चला, क्या खाया, हिसाब बता। नहीं क्या, गुड। सो इट स्टिल हैपेंड, आई मीन। नहीं क्या,
Same experience. I just felt like once I open my eyes, it will be you in front of me asking me the same question again, and then I have to bring my mind back again to the music itself. So I could see Kate Winslet dancing, but then again I felt no, I have to concentrate on the music again. Yeah, that was it.
यस सर,
पहले से ज़्यादा रिलैक्सिंग था।
वेरी गुड। यस मैडम।
आपने कहा था कि आपके मन को बहने दो, तो मैं भी बह गई। मैंने कहा ये गाना रुकना ही नहीं चाहिए, एंड आई वाज जस्ट इन माय ओन वर्ल्ड, दैट्स इट। व्हिच वर्ल्ड? आई वाज जस्ट सीइंग द होल मूवी इन फ्रंट ऑफ मी एंड इमेजिनिंग माई सेल्फ टू बी पार्ट ऑफ द मूवी। यस।
आप जहाज में पहुंच गए थे क्या? बिल्कुल।
In this one, there was a sensation of swimming in the ocean. That sort of sensation was coming, and later I think I just kind of
सेंसेशन डिस्क्राइब कर सकते हो क्या कि स्विमिंग इन ओशन में आपको क्या फील हुआ? हाउ यू हैव फेल्ट दैट यू आर स्विमिंग इन द ओशन?
No, I mean you feel like you're
आपको
diving.
दिखा
हाँ,
या आपको कुछ ऐसा महसूस हुआ?
हाँ, वो भी होता ही है साथ में। बट जैसे you're diving तो कैसे सेंसेशन होता है, that cool feeling, and also you can the flora of the ocean वो दिखने लगता है, जैसे डाइविंग का एक्सपीरियंस रिलिव करने लगता है। Yeah, you can almost feel it. I mean, yeah, that
ठंडा था
sensation.
पानी या गर्म
हाँ,
था? कैसा लगा आपको ठंडे पानी में?
ठंडा।
आपने ये किया या
डीप वाटर तो कूल ही होता है।
कूल लग रहा
cool
था?
लग रहा था।
ओके।
It started with the movie scene, but sir का वो instruction याद आ गया, ज़्यादा noise मत होने दो। So I started concentrating on my muscular pains, aches, and relaxing those part of the bodies to feel more relaxed.
Okay. So you were started
With the movie scene only.
movie scene,
Yes.
and but then you have focused on
Yes.
more of your body
Yes.
parts.
Yes.
Okay. Sir,
I thought I was like skimming over ocean, so it's like that's it, nothing else.
दिख रहा था क्या?
नहीं मतलब
क्या आपको फील हो रहा था?
I'm just moving, low level, flying over the ocean. दिल है कि मानता नहीं, मुश्किल बड़ी है रस में मोहब्बत, ये जानता ही नहीं।
दिल है कि मानता नहीं, दिल है कि मानता नहीं।
नहीं मान रहा है दिल फिर भी।
No, this particular music set is very, very dear to me. So I listened absolutely to the music this time around because I hated the movie. The very concept of the movie I hated. That's another story.
Which movie?
But
Titanic.
You hated that movie or?
no, that came and went very quickly because any which ways I know it's going to happen. So why waste my mind space in that? So I don't want to choke my bandwidth. I want to listen to the music. The music is seriously good. So I concentrated only on the instruments and the nuances that they offered. So I concentrated this time a lot. I would say 80% I concentrated on the music. Balance 20% will be there.
Have you tried to differentiate that which instrument was prominent as such?
Yeah. So first you have the trumpets, then you have the flute, then you have the drums. So yeah.
Okay. Dissection was there. That which instrument what? Okay.
त्याच्या शेवटच्या गाण्यात तर आमिर खान अजूनही दिल मानतच नाही असं वाटलं आधी. पण गोईंग बॅक टू टायटॅनिक, इट visualized as a Disney movie character playing around because of the varying instruments, and later on it appeared like a tug of war between the gods and demons in the Amrit Manthan, because there was two types of thoughts going on. One was about the responsibility that needs to be fulfilled, and the other was towards the end of the world, where you need to be going with Atma Samarpan, where everything is going to end. That was the yes, that because that went with the flow of the movie as well.
सर नॉट एनी मोर दिस हिंदी सॉन्ग्स. पूरा कॉलेज का लाइफ दिल है कि मानता नहीं में इन अ फ्लैश पास हुआ. बट बिफोर दैट सॉन्ग आई वॉज एक्चुअली ऑन द डेक. आई कुड सी दैट शिप. केट विंसलेट बन गए थे वहाँ जाके. एंड आफ्टर इमेजिनिंग दैट, आफ्टर सीइंग दैट, आई सॉ राधा कृष्ण ऑन अ स्विंग, swirling around and then unswirling, and it was like all the entire VFX I could see, butterflies and everything. And again went back to, I wanted to go back to on the ship, but I was coming back to that Radha Krishna. So I don't know.
Very soothing, very pleasing music. I didn't connect to any picture or any scene, just enjoying the melody and the happiness in that. It outside, feeling very nice. I wanted to take it inside me. I took it inside. Whole body was gradually relaxing. I'm feeling so nice, peaceful, away from the whole world. लेकिन म्यूजिक रुक गया.
लेकिन म्यूजिक रुक गया. This time you have done?
This one I had actually missed the previous music. This time, before this music started, I sent a message home because I heard Dr. Vani mentioning about the maid, and I finished doing that job before the music started. So that the music does not, my thoughts don't get interrupted because of that. All along the thought, it began by myself thinking that sir is going to ask questions. That's how we are trained. So from the beginning, I was only concentrating कि बाद में क्या बोलना है. But slowly I got so immersed into that music that I just listened to the music till the end. I got goosebumps.
Goosebumps? Yeah. You felt that?
Yes.
So there are bodily sensations also.
ठीक है. So I think, but by and large, all of us agree that it is not easy for people to follow the instructions. That is the main headline, as Vaishali madam said, that it is not easy for people to follow instructions, even if they want to. We don't want to, suspect the intention of our patients, but it is just you can say, in other words, it's an exercise in empathy, that how hard it may be actually for any human being to follow the instructions. Because what is true for us is also, same thing is true for our patients also. If our mind can't kind of, despite having the intention, it cannot, do the action. Obviously, for patients also this holds true. Even if they have the intention to walk or intention to follow certain diets, etc., it is hard for them to do. Because of this particular property of brain, nicely summarized here, दिल है कि मानता नहीं. तो ठीक है, this is good enough neuroscience learning for us कि दिल है कि मानता नहीं. So therefore now the new emerging understanding is that shall we take a surgeon's approach? ना, surgeon doesn't directly go and do the surgery. नहीं क्या surgeon क्या करता है, पहले patient को anesthesia देता है. एग्जामिन तो सबको ही करना है ना क्या, साइकेट्री छोड़ के. पेशेंट बोलता है आपने मेरे को एग्जामिन नहीं किया, मैंने कहा वो डिपार्टमेंट इधर नहीं है. तो बेसिकली whether there should be some prior preparation of the patient's mind so as to enhance the success of lifestyle measures. Okay, and that is where a very important role of certain techniques in which currently yoga is in the forefront is emerging. So the purpose of yoga is not to lose calories. That is clearly understood. Yoga is not to be done as a physical exercise or in lieu of other physical activities, but the purpose of yoga in the overall lifestyle management of patient is the same as that of anesthesia and surgery. In modern surgery, one cannot imagine doing a surgery without anesthesia. We cannot, isn't it? There has to be anesthesia. So the patient, I think, deserves to be taught the skill of self-regulation. Self-regulation means कि खुद के माइंड को उस मुकाम पे लाना कि जहाँ पे वो सुने अपना. So there is an ultimate democracy, inside our head. Like we don't want to listen to anybody, so does our mind. Mind doesn't want to listen to anybody. So there has to be, certain regulation where the patient का जो intention है, may have a good intention, that I want to follow the doctor's instructions, I want to follow the lifestyle, but there has to be the patient's mind's preparation so that the good intention can actually be translated into good action. This has now been recognized as one of the most important neuroscientific barrier. It is a real barrier, it's not an imaginary barrier, it's a biological barrier. Of course, we can go into the elaboration, so why this happened, why the brain continues to do its own activity, despite giving it instruction, why does it, not listen to that instruction? But that is what it does, that is a fact of life in the end, whatever science behind it may be, and therefore we need to prepare the mind. So just keep it in the mind that sometimes we need to have this empathy with our patients. Otherwise, very often what happens is we are wondering as to, why मराठीत काय म्हणतात त्याला, पोट तिड़किनी, नहीं का, पोट तिड़किनी. यानी मैं इतना इफर्ट डाल के इसको समझा रहा हूँ पेशेंट को कि भाई तेरे लिए क्या अच्छा है, तेरे लिए क्या बुरा है, पर इसको क्यों समझ में नहीं आ रहा है. उसको समझ में आ गया है, उसको प्रॉब्लम समझ में आने का नहीं है. प्रॉब्लम ये है कि उसको एक्शन में ट्रांसलेट नहीं कर सकता है, बिकॉज देयर इज अ गैप बिटवीन दैट. So in order to translate the thinking into action, we need a faculty in between called as the ability to self-regulate. You all know about homeostasis, which is an automatic regulation. You all know about even perhaps allostasis, another form of automatic regulation. But in addition to these, we need to bring in some training into the self-regulation. And for which, one of the currently based options, evidence proven, I would say, for which a good evidence exists, is the best approach possible is of yoga, and that's why it has shown excellent, very promising results in overall management of diabetes, and now there are a lot of clinical trials available, even meta-analysis of yoga in young people. Now people are most interested, because we know that it's from the childhood and the adolescent, that this whole problem starts actually from a very young age, and whether this particular faculty is helpful. The entire humanity is sort of on a dimension. Maybe there are some exceptional people, as they say, walking the talk. So they can actually implement, what they talk, they can implement in action. There are some exceptional people like that. But most ordinary people like us, sitting here in this hall, average people, some people call it as a mango man, the common आम आदमी, भारत का आम आदमी, मैंगो मैन ऑफ इंडिया. तो भारत का आम आदमी जो है ना, उसको सबको ये डिफिकल्टी है कि इवन दो वी में हैव इंटेंशन, वी इंटेंड मैं आज बैठ के पढ़ाई करूँगा. नेवर हैपन्स, so many kind of distractors, internal, external distractors are there, which easily distract, the mind. And therefore, so that, you clearly understand, that what is meant for what. So yoga in some way you can consider as the anesthesia before you, sort of go on for doing more elaborate kind of, maybe day before I think she did a progressive muscular relaxation exercise for you. It's also something part of that. And I just show you a couple of slides. Okay, so we use some of these simple common language to explain to our patients that brain is like a popcorn machine. All the time we are having this type of activity in our mind, and we have to, if you are ready, you can try this slightly one more level difficulty exercise. What you read there? This time there is going to be no music. So this is a slightly, you can say, next level activity. Try this, maybe. I can assure you I will not run away. I will wake you up after a few minutes. Okay. I will not leave you here with all the eyes closed and waiting, as to when to open the eyes. So just try this out, close your eyes and sit in silence for a few minutes. Okay, you can open your eyes now. And yes, from here, about this experience.
In the start, I saw Om figure, and immediately it washed out, and then I feel like sleepy. That's it.
My thoughts were flowing. Just I could listen to the music which you played, the very first music. But then again, I trained my mind again that I have to bring my thoughts from so many thoughts to having no thoughts at all. So I tried a lot to bring my mind back again. But still, then I couldn't be silent. Yeah.
Actually, we use this technique to increase the concentration daily for 15 to 20 minutes. So I feel very relaxed and some cold breeze moving through hands and head.
So you do this practice 15 minutes every day. Okay. And what is the intention? Why do you do this practice?
To increase concentration.
To increase concentration. Okay.
I was just flowing without any music, but thoughts were coming. So then I said, I have to stick to my breath. Then I caught my breath, then the thoughts became a little less.
आपका ब्रीदिंग पे ध्यान गया है?
हाँ, ध्यान नहीं गया, मैंने
ब्रीदिंग पे लाया ध्यान.
हाँ, लाया मैंने.
लाया ध्यान.
I didn't want to go everywhere.
Breathing ने बचा लिया है.
ब्रीदिंग ने बचा लिया आपको.
This time I think so many thoughts I could not control anything, and nothing really happened. Matlab lot of thoughts only.
Thoughts आ रहे थे.
Thoughts were overflowing.
Overflowing, flooding था.
Flooding था यार. उसको भी था मैडम. Thoughts are overflowing for everybody.
I was waiting when sir will say open your eyes. I was finding it very difficult.
Was it difficult?
It was.
To sit in silence?
Very hard.
Very hard.
Very hard.
Honestly, I was thinking, when will I get a cup of chai?
So ये thought आया सर को. चाय की इच्छा हुई. Okay, चाय की इच्छा हुई. सर को चाय बाबा. He can. हाँ. Yes.
Sir, what you said, prepping the mind for lifestyle changes of a patient, maybe I was able to relate, maybe, that why आपल्याकडे पूजा करून देवाची बाहेर पडायचं, कारण तेव्हा आपण सगळ्यात जास्त शांत होऊन मे बी वी कॅन गेट अ पर्स्पेक्टिव्ह की आज काय करायचं आहे आपल्याला. सो आय वॉज एबल टू मे बी रिलेट टू दॅट. नाही, जसं मॅडमनी सांगितलं की ओम हा शब्द माझ्या डोक्यात लगेच यायला लागला. So that immediately quietened any and all other things which was there.
एक ही थॉट था, कुछ भी हो जाए सोना नहीं है.
So you were resisting yourself not to stay awake. Okay. Yes, you can. Ready? Yes.
So I do meditation. So जो technique है मेरी meditation की immediately kicked in, but of course I still get lot of thoughts, and then I come back to that Bij mantra, and it is quiet for some time, and again the thoughts come. So I don't stop my thoughts, but yes, it takes few seconds away from the thoughts. But one thing I remember at the end, that I forgot the garlic while making dal in the morning. So that was one thing was very clear.
Continuously thoughts are flowing, so I couldn't able to concentrate on anything. Yeah, it's a random thought. No, it's a random thoughts. I couldn't able to control and yeah, moved on.
I actually enjoyed sitting in silence. This was better than the music thing.
Okay. So what was the feeling? How it was different from the...
Lot of quiet and some background sounds were there, but lot of quietness I felt. Nothing beyond that.
Nothing beyond that.
No.
I want to ask, how do you define silence? Do you want thoughtless state, or you want just like, you said silence. Everybody's talking about controlling the thoughts, which is I don't think would be possible for anybody, at least in this forum. Maybe there would be people like that. So as sir said that there are too many stimuli we are getting, so the visual stimuli were cut off immediately. So we could actually, cut down maybe 80% of the stimuli. So it gives you a feeling of calm. And of course, we remember some important unfinished tasks. So not a very random kind of thought process, but that's why I wanted to know, like, what is the definition of silence when we say sit in silence? So
I felt it was very calm, and mind started wandering actually. It went to various. I was thinking about my workplace, what is to be done tomorrow, and all this. But it was overall a very good soothing effect for me. Thank you.
I meditate regularly, point meditation, and so immediately got into that set, and I was just no thoughts, nothing, quiet breathing and meditating. But the sound of darwaja, baat karne, they were slightly disturbing. Gradually I could shut them off afterwards. When sir told to open eyes, my eyes were absolutely heavy. Gradually I opened it.
So, can I share one thing?
Yeah.
In all the three activities, what happened in the first go when the music was playing, it was quite refreshing. In the second go, when you said that you don't need to control your mind, there were lots of things, visuals which were coming up, kind of related to sea or water. And right now, when the practice was about sitting in silence, in all the three activities, some or the other thoughts or some or the other visuals were happening, they were occurring. But the end result of everything was little different. And the end result of sitting in silence was really feeling that quietness or that peacefulness. So, how is it happening? Is it because of we have stopped the stimulus of music, or there is something else? And I was observing my thoughts in the third activity.
Sangla, yaar, we have collected some very deep questions. Like, why does this happen? Or he asked for what is the definition of silence, so which is nice. So before we go to these more difficult questions, let us quickly summarize this for our own selves, conclude this, that mind is almost like a herd of sheep. And what does a herd of sheep need? Okay, so the herd of sheep needs a shepherd. So the activity in our mind, in other words, it needs a certain direction. It needs a certain regulation. Why it happens? I show you in a moment, why it happens. So this particular research helps us understand why it happens. Okay. You are listening, I am sure, from day one that instead of the anatomy of brain, we are now interested in the functional architecture of brain. So brain operates in the form of various networks. And this particular person of Indian origin, Vinod Menon, he is the director of cognitive sciences at the Stanford University. Very elegant formulation he has given about these networks. So broadly, there are multiple networks in the brain, but the three most important networks which are involved in all these phenomena, one of them is called as the default network. As you can see here in the blue, the default network. Default network consists of many brain parts from where all these memories, imageries, sensations. So what happens is that when you are listening to music or even during the silence, the default network, kind of went into a overactivity. And the default network was generating all this stuff in your head. Okay. There is another network, the red network called as the executive network, which helps you, to focus attention and reduce the activity of this default network. But the most important part and interesting part is the yellow, called as a salience network. Salience network actually is like a switch and like a camera which allows you to precisely see what you want to see. In an untrained brain, all these networks, they work in a random fashion. So brain needs a lot of training. If you train your salience network, it allows you to exactly select, what you want to do. So the key to self-regulation is this, your ability to focus the salience, selective, you can say selective sort of attention and also selective action. This is extremely important. I think some of you must be here yesterday. Professor Shriram, he spoke about a lot of elegant research about the role of GABA in the brain. So GABA does this activity. Like I told you, we just were discussing that maybe, we have 1 billion bits of data flowing into our brain every second. And we can only see the 10 bits. So GABA does this good part of job to help us, in this selection, that what is the 10 bits that I am interested to see. So we can choose what I want to see, and I also can choose, what I want to happen, the action. Now, coming back to, sir, the silence, silence is about the action, so that I am not doing any action on it. So selective attention and selective action is the basis, for the so-called self-regulation. And the whole purpose of yoga is basically to train this particular network into implementing, so you get a thought. If you have this strong network, salience network, then you are able to translate that thought into specific kind of action. Otherwise, what happens is you got the thought, but the default network activity continues to disturb it, and it is the default which is the strong. So in the movie, when Amir Khan sings Dil Hai Ki Manta Nahi, Amir Khan is referring to the default network, which we in an untrained brain does not have the capacity to be controlled. It's like a mountain stream which is flowing with its full flow and which you cannot regulate, which you cannot control. So the default state is actually quite powerful. So this whole training therefore is of this particular brain network, because once you have this trained brain network, it gives you a possibility, to translate your intention into your action. Okay. And it is now very clear, because of this neuroscience idea, that we cannot expect untrained people to translate the so-called, lifestyle change or any kind of behavioral change. People cannot change their behavior unless they have control onto these brain networks. So we have to train actually, the brain network to translate what I think into the action. Okay. Otherwise, for most part, for most untrained people, 99.99% of work of the brain happens in a completely automatic mode. All of us, unless we develop the facility of self-regulation, we are on an autopilot actually. We just have an illusion, that I am the master of all the actions which I am doing, which we are not. A lot of neuroscience research has very clearly demonstrated it, that the action has already fired, in the brain before we even are aware of it. Okay. So 99.999, whatever you may keep on counting. And we only have this illusion, that I am the master of my own thinking, my own actions, etc. Most instances, they all are happening at a subconscious level or in a very automatic fashion. So in order to convert it into something actionable, we need to have this. That's why I said that this training is sort of an anesthesia which is necessary for whatever work that you want to do with all your NCD patients. And then you can see that it has a better chance to stick. So if you are asking patients to follow intermittent fasting, if you are asking your patients to follow regular exercise, it has a higher likelihood to stick if they have received this training. These are the people, I am sure you all must be seeing in your practice that there is a high dispersion. They are not like one uniform group. There are some very disciplined patients who are able to translate it into action. People have sort of, in a funny way, have called it as a rule of 1/3. 1/3 people, they are self-organized. You don't have to, keep on instructing them. They are able to translate what you tell them, that into action very readily. 1/3 people are incorrigible. Whatever you train them, you cannot discipline their brain, whatever your advice may be, they cannot be. And 1/3 are the fence sitters. So it is the fence sitters who can help by, these kind of techniques. So a fence sitter with little bit training is able to be more disciplined and is able to translate, all these aspects into more practical things. So that's why somewhere it becomes imperative or it becomes necessary, whatever you may want to call it. You want to call it brain training, you want to call it network training, you want to call it simply disciplining the brain by whatever, shepherding the brain by whatever name you may want to call it. But the idea is that it has to have this possibility, okay? Then only it will work. You work with your own self, maybe you work for 1 year, maybe when we meet next year, we can play the music and you can see, whether your own random thoughts, I mean, at your home, you can do these experiments. Whether your random thoughts have become less now, whether your brain is more able to adhere to the instruction. It's not bad, default state is not bad because that is where our whole creativity also comes from. But the point is that, is it relevant, for a particular task? You don't need to get creative about everything in life, When you need to be creative, it is good to be creative. And when it is need to, follow certain instructions in a disciplined way, it is necessary to do it at that time. When you are driving, it is necessary, that your eyes are, isn't it? No? Because if, your brain goes in fantasizing when you are driving, then the results are hazardous, So there is a time for fantasy and there is a time for driving. Okay. Thank you so much.
एक टी ब्रेक लेके फिर से आते हैं बिकॉज what I want you all to understand is that how brain normally responds. So brain has a very dynamic state of response because at some times it behaves like a coconut. Sir will tell you more about it. Sometimes it behaves like a boxer. Sometimes it behaves that's a surfer who surfs in the ocean. So why is it important to understand this? Because our patients are those kinds. They have that dynamicity of the brain. So we need to understand how brain responds to different stimuli. And if you have to see in one person, the same person can have dynamicity of response with different stimuli. So I think it is important to understand how brain reacts to every stimuli. And we as people of science and physician background, we hardly understand how a patient would react unless we don't know this neuroscience. So I think This is one thing which you will never get to read in books. So I think we use Sir's wisdom. So you can take a tea break, come back with a tea cup, and you need not stand there. You can come and take your tea and on the table. So please have a tea break. नका तुम्ही हो okay. So basic what we need to understand is that when unregulated mind is actually given any instruction, that is the time when the person is not going to follow any instruction. So first of all, the simplest thing that we follow in our clinic, probably madam can tell in our clinics what you are trying to. So you first tell the patient the physiology of how the mind works and how it is has to be got into that state of salience, so that you can start with the basic activities. So the simplest is to get into introspection mode. So do you feel hungry? How hungry do you feel? So now you all have had a cup of tea. So what are you all feeling in your stomach? So if you can write down, that is a good introspection. So what do you feel now? चहा घेतल्यावर तुम्हाला कसं वाटतंय? नाही, पोटात कसं वाटतंय? भरलेलं वाटतंय, जड वाटतंय, गरम वाटतंय, शांत वाटतंय, ॲसिडिटी वाटतेय, शांत वाटतंय. So that शांत feeling is introspection. So you may get any other feeling. काही जणांना वाटतं, बरेच obese patients tell us that काही खाल्लं तरी वर आल्यासारखं वाटतं, जळजळल्यासारखं वाटतं किंवा घशात अडकल्यासारखं वाटतं. That feeling is that they are able to judge their internal sensations. Now internal sensations, not all are able to have that cognizance of that. So what we have seen is that एखाद्या पेशंटला तुम्ही विचारलं की तुला काय वाटतं जेवल्यानंतर, तुला तृप्त वाटतं, भरल्यासारखं वाटतं, थंड वाटतं, ॲसिडिटी वाटते, जळजळतं, पेशंट कॅन नॉट क्लासिफाय. सो द सिम्पलेस्ट थिंग इज यू कॅन टेल द पेशंट की तू जेवल्यानंतर तुला हे फिलिंग काय वाटतं, पोट भरल्याचं फिलिंग येतं का नाही येत. मोस्ट ऑफ द टाइम्स आन्सर इज कळत नाही. So have you tried speaking to your obese people as to do you get the feeling of hunger or satiety at times? Satiety कोणाला कळतच नाही की समाधान हे काही केलं तरी याचं समाधान होत नाही, असं आईची तक्रार असते की किती खाऊ घातलं किंवा जेवल्यानंतर पण किती वेळानी त्यांना अजून त्याच्या आवडीच्या गोष्टी दिल्या तरी त्याचं समाधान होत नाही. सो त्यास देअर द सटायटी सेंटर इज ॲट फॉल्ट. सो तिथे these drugs like GLP-1 are going to work. So I know that the satiety is at fault. Now, if the patient is getting hunger pangs, can sense the hunger, and still he's getting obese, there I think of something like an anti-motility agent. So I think of GLP analogs there. So tirzepatide will work in the first patient where satiety inducing just role hai त्याचा, while GLP will work where motility has to come down. So it decides my acumen for treating obesity when I'm introspecting or when I'm asking these questions. So I think this is so crucial for us.
Techniques to induce parasympathetic. So we use all those techniques. Yeah. Because the sympathetic overdrive is very common in all obese patients. And that is why it also lead to other NCDs because of the sympathetic overdrive. As sir has mentioned that it plays a very important role. So unfortunately, we are not having that specific kind of means these autonomic drugs. So we have to use lot of non-pharmac techniques which can induce all these things. Breathing we start afterwards. First relaxation. Relaxation is the easiest way to induce parasympathetic. JPMR or PMR. It's a variation. We do use imageries, we use PMR. So different kind of techniques are there.
See, the best part is that, the equipment like, for example, heart rate variability, it allows you to check on a patient, whether it is inducing actually a parasympathetic stimulation or not. So it is easy to check that. Good. So I think you all had a tea, feeling relaxed. We are not going to we will not listen to Vaishali madam, so we will not do any exercises any longer, but we will try to see some enlightening videos. So it is clearly understood that only few human beings are born ekagra. Born ekagra means that they have a good control on their default network. उनको मराठी में संत बोलते हैं उनको, नहीं क्या? In other languages, I don't know what they are called. Yeah, Santa Yogi. So they are the people, who by birth have more regulation ability on their default network. Rest of the humanity is all the same. Dil hai ki manta nahi, rest of the humanity is into that. And you can see the force of habit. What we are talking about as a habit change is a big problem, kind of in this whole domain. And in obesity, as Vaishali madam said, so one of the best depiction कि habit क्या होती है और habit का force क्या होता है, was depicted actually in this. I will show you this, the force of habit. Good. So the moment you will realize and conceptualize that feeding behavior, sedentary behavior is a compulsive behavior. Even if people want, they cannot stop it. Stopping sedentariness, stopping the screen time, or altering the behavior thing, they are almost like OCD. Although we formally do not call it a obsessive compulsive disorder, but this is the force of the habit or the force of compulsion. People literally are compelled to, although they know that this may be harmful for health, but they are compelled to do that. So I was having discussion with him, Shivram sir. He's an endocrinologist from Nashik, and personally he has learned yoga. Of course, he's well trained in that, but he's very fond of behavior therapy. So that is what we were discussing, just on the sidelines, that nowadays it is fashionable. People think that the talk therapy is useful, but in all these instances, it's the good old behavior therapy which is necessary to change the habit. Any amount of talking does not help with this problem. It is the behavior has to change, and behavior change means the network. You have to gain a mastery over the network which causes this. Okay, I'll show you now another video. Okay, you have a look at this video, as Vaishali madam said. So, and you can recognize, where we apply this particular strategy.
Some great songs have been written about boating, but the one thing they never seem to mention is seasickness. So if you're on the sloop John B., you of course want to ride, Captain, ride. And the last thing you want to do is rock the boat, baby. Now, if you come sail away on your love boat, you certainly don't need to be like the wreck of the Edmund Fitzgerald. But now there's one innovation that could make it so you never want to be sitting on the dock of the bay. Here's Ali Ward to explain. Did anyone under the age of 50 get any of those references?
If only the water was this tranquil every time you went boating. But that's not reality.
There's a reason of why "don't rock the boat" is an expression for upsetting things, right? This is a basic human experience that's uncomfortable. And if you can solve that problem, that's a big deal. That's exciting.
Avid boat lovers, Shepard McKenney and engineer John Adams set out together to solve the problem of boats rocking when the waves are rolling. What they created is a stabilizing gyroscope called Seakeeper, designed specifically for use on boats greater than 27 feet long. The relatively lightweight sphere is placed on or in a boat, and they say it can reduce boat roll by up to 95%. Can you see the difference here between one boat that has a gyro and the other that does not? Inside the sphere is a high-strength steel flywheel, the motor that drives it, and the bearings that support it.
Our fastest flywheel spins at 10,000 revolutions per minute. And all the air inside the sphere has been evacuated out.
I met Shep and John at their factory in Mountain to perhaps do some boating.
Can you explain to me how does it work? What's going on inside?
These four corners are mounted to the structure of the boat. And when this flywheel is spinning at a high rate of speed and the boat starts to roll, the flywheel senses that motion and it wants to tilt or precess in a fore and aft direction.
Oh, so okay. So if we were on a boat, the boat might be rocking this way, and meanwhile, the gyro is going this way.
That's right. It goes at 90 degrees to the direction it was disturbed.
Their gyroscope combines a number of technologies to make an old idea viable today.
You look at this thing and you say, it's just a spinning flywheel in a containment. It is such a technical task to get it to do what it does.
The gyros are built and prepared for installation here in Pennsylvania.
The most interesting part of this is these hydraulic cylinders, and they are computer controlled to regulate that precession motion to keep it in phase with the rolling motions of the boat.
The open water was calling, so we met up on their boat at a nearby lake to sample the technology. We started at the dock with human-made rocking.
I'm no engineer, but I can tell that this is not very steady.
So call it.
Okay, engage gyro. No way. That is just bonkers. Look at this, you guys are still going. You can't do it.
Even though it was a calm lake, we tried to make some waves anyway.
So we're gonna just make some waves, and then we're gonna shut them off, essentially. Oh my gosh, whoa. Wow. Oh my gosh, how are we not rocking? I mean, I realize that that's a complex answer involving physics and engineering, but that is nice. Wow.
So who would like to offer some comment on this? Anybody about this example?
Our mind should have some gyroscope to control the emotions.
So the hunger should have a gyroscope. Balance it. And what balances it normally? Exactly.
Hypothalamus.
Center in the hypothalamus.
Sir, you want to say something about the gyro? Training people to have the gyro.
Yeah, the awareness about the feeling basically. We just ignore the feeling of fullness. Maybe because of TV, mobile, hurt, whatever, everything. So we just be aware about the fullness.
So being aware itself actually is the first way. And if you become aware of some behavior, like you saw in that music example, at the moment you become aware that you are doing something, you try to put a break. If you are unaware, the likelihood that you can stop the behavior is not there. Good, so you have to be aware. So awareness is one important gyro. Satiety is another gyro. So obviously, that we know that the rocking happens when these gyros are failing. They are supposed to, keep the whole turbulence in check, and that is the time when they are failing. This is also an example, sometimes that uh, you can say, metaphorically speaking, the boat will always be rocking in life, isn't it? Life is never going to be a quiet lake. And then, of course, then when there is a perturbation results in the form, people try to stop that perturbation by maybe unregulated eating. Some people can put a wrong type of gyro also in place. So you are stressed, there is a turbulence, and you think that, that eating will stop actually the turbulence. So a simple example, which can help us understand this activity, that any unbalanced or unregulated activity, what kind of consequence does it have? And luckily, nature has given us many gyros, like someone said the hypothalamus, someone can say the autonomic nervous system has a brake and an accelerator, isn't it? Sympathetic works like an accelerator, so you have been given a parasympathetic brake to it. So nature has given us both. Within the hypothalamus itself is the hunger center also and the satiety center also. Because we want to have both, we want to initiate some activity, but we also want to stop the activity. So it's and same arrangement. Just now I showed you the default network gives you the flow, while as the executive network sort of caps it. So both type of accelerator and brake activity is given. So whenever there is an inner imbalance, between these two faculties, this is what typically physiology people call as a homeostasis. That when a parameter starts going out of range, there is a mechanism which automatically should start to bring it, back on the track. So therefore, one of the ways in which you could look at actually the problem of obesity, of course, is a homeostatic failure. As Leena mentioned in her lecture on day 1, that obesity has a problem of somewhere as a homeostasis failure. When the natural mechanisms which should regulate the weight, they are not operating. Okay, let us watch gyro failures. So obesity also is a gyro failures. It could be a failure of awareness, it could be a failure of satiety, it could be a failure of autonomic, kind of a gyro failure. So we know, heightened sympathetic activity, heightened inflammation. Inflammation also has a pro and anti-inflammation. So when the pro-inflammation is up, anti-inflammation is not, kind of keeping it under check. So these multiple gyros, which are available to us in the body, when they are not working in an appropriate way, then this particular happens.
Apply the medicines also to correct the gyros or other non-pharmac approaches which can also help to correct the gyros. So combination of these.
So the obesogenic environment is actually the storm. So you have a obesogenic environment around the patient. He's having familial conflicts, he's having divorce at home, he's having food which is very high rich calorie. There is a lot of food available. And so many obesogenic environment factors are actually creating the storm. Now it is the problem that we have lot of factors in the obesogenesis, but very few factors which are developed in the gyro. Why? Because we have never trained our mind to develop a gyro right from childhood, and we have never trained our children. We've trained everybody for physical exercise. But mental exercise has never been portrayed neither in school nor in colleges nor in individual practice. So mind gymming is a big task. And mind, like you are a sports person, you are gymming, you are running a marathon. For the mind, what is a marathon? You understand? So if you think of running a mind marathon, you might fail drastically, though you are an excellent marathoner. So there is a need for mind gymming right from birth, and that comes through resilience building. So why these videos are very important is that these are videos which tell us how to build resilience, how to improve the gyros, and how to use the right gyro in the right scenario. So I think we'll go ahead to this, and then we can come back to the discussion.
Compared to the first video, what is happening here in this one?
So life is up and down. It's like waves. So every day we are up, we are down. We are facing challenges. We are facing so many difficulties, obstacles in our life. So we have to learn to adapt, and we have to learn to ride the wave.
Ride the wave.
Is it about balancing?
Your waves. Anybody here?
First, I think that not every wave is worth riding upon. First of all, we have to choose which wave to ride upon, which wave to surf. We have to be very choosy there. Once we have the opportunity, we should not be thrown down by the wave. We try to remain stable in spite of the movement of the water. And it could still be an enjoyable activity in spite of such a bad wave. That's what I could take it.
Yes. Sir, your physics knowledge here. Gyro, waves, your physics knowledge. What is the situation?
Basically, as Chandradre sir said, that knowing which wave to take and which one to avoid, and it's also a very high skill sport. So you will have a lot of failures before you see success, and you have to be very prepared for these things. Every day will not be a success. You may see one in 10 days, maybe not even 10, but perseverance may help.
Good creative ideas, from a Red Bull video. Yes, Joshi sir.
This video showing only one wave, there is no choice of selection of wave. It's just coming behind him and he's staying ahead of it and navigating himself safely through the safe waters. Though he know the back the wave is going to come over him, he's trying to stay ahead of it. I mean, in spite of a problem chasing him, he's staying ahead of it and finding his way properly.
Staying ahead of the wave. Madam.
I think he's taking everything moment by moment and persisting with the effort. Not thinking about what will come next and whether I will be able to do it or not.
Good, great.
Whatever happens, he has to be away from the shark in the waters.
Hello. It's more of an act of balancing actually, and the thrill which one should enjoy.
Good. You want to speak? You want to speak? Yes. Anybody here? You want to speak now? You want to find?
So generally, even for craving management and in things like when, especially in borderline personalities, when they have that urge to self-harm, we teach them skills like riding the wave like this. It's very useful for them.
Yes, sure, please.
So, as a child, in my grandfather's house, behind the house, there was a river. And we never did fishing. Other people were doing fishing. But my father used to make me sit there and to read the river, to just listen to the river, to listen to the sound of the river. And I never used to understand that at that time. But now, today, when you're saying this thing, I'm understanding that reading the river, reading the wave is about reading the problems in your life and upskilling yourself every single day to face life as it comes and to adapt to life, to be flexible in life. That's what is getting reminded of.
Very good. This is very interesting, actually, application. So during songs, your default state was in a random fashion, isn't it? Now you are doing a creative thinking, but not in a random fashion. Related, to something very specific, very targeted. Now, this is also coming from your default. All these creative interpretations, isn't it? Now, from, as he said, sharks to, Joshi sir said, staying ahead of the wave. Someone, madam said that taking wave one instance at a time, to someone said, that making use of the waves, etc. So now see, you are making a constructive use of your own default. Okay, good. So I will tell you, what could be the, yeah, madam.
So now, in terms of obesity, yeah. Yeah, so it is different. You know that there is a storm of hunger which a person cannot control, of craving that they cannot control. So we cannot tell them that you stop having the craving. You can't tell the person that you don't crave for sweet food. But then you have to ride that wave. So you have to give them options as to how they can ride that wave to not curb their craving, but to give an alternative. So here is the role of nutrition psychiatry. So what they can offer to your obese patients in that moment, and one is that a gyro can be employed by the person if his hedonic control is good. Suppose person like Sujit who is doing yoga daily, Dr. Joshi is doing yoga daily. They are very well controlled. Their hedonic control is good. They can control it with their gyro. They can control the hunger pangs, the cravings. Even if there is a huge buffet, a good dessert spread, they will control it with their hedonic. But not all our patients have that gyro. So there are patients who are going to have these waves. Those waves will be mental waves. They can be surges of anger. They can be surges of discomfort. They can be surges of moments of, you can say, weaknesses where they are in front of food. You have to give them answers as to how to ride that wave. Now, each one, for example, so Geeta yesterday told us an example that when you are hungry at 5 o'clock, it's a wave which is coming. It's a hunger wave. What is the right thing to do? Should you curb that wave? Should you drink water and say that you'll eat later? No. She told you that you have a protein supplement or you have a protein, say 100 grams, and that will curb that wave. You will use that wave to ride over the crisis, and then at 10 o'clock, the person is not going to eat at night. So I think we as doctors need to identify that. We need to teach our patients to identify that. So what a nutrition psychiatrist would do is she would help that person to identify those waves and how to overcome those waves in a healthier fashion so that it gets for the benefit of his health rather than this. So obesity involves lot of mind education. That is what this whole thing wants to highlight, that you cannot tell the person that you eat healthy and one prototype diet chart, it's not going to work. You have to identify whether the person is having strong gyros. You have to identify whether his waves are bad. So he has episodes where he is fighting with his wife and after every quarrel, he tends to go to the bar and have a bout of alcohol. You have to help him get out of that, uh, rather ride that wave, you can say, in this, exemplify it in this fashion. But here the nutrition support, here the support of autonomic control, improving the gyro strength is going to come into picture. So this is how you use this knowledge.
Absolutely. No, and just to add to that, basically it is not only the food as a substitute to food. There could be multiple other ways of satiety, because finally it's a problem of, that hunger pang, as Madam rightly said, isn't it? We call it as hunger pang, in common English. That wave, strong wave of hunger pang, you will fall down many times, but then the idea is that to generate a satiety, and there could be several other substitutes to that, to satiety. Yes. Yes. Okay.
Lady. So, yesterday someone showed the example of a obese lady, and you told the story of the obese lady. So she could go into the painting. That painting gives that same satiety which any sweet dish would give her. So identifying what actually would help the person to ride that wave. So you could identify that she had painting or a hobby. So you have lot of pleasurable activities, and भूक ही भूक असते. ती कुठल्याही गोष्टीची असू शकते. ती अन्नाचीच असेल असे नाही. सपोज समाधान मिळालं, तर भूक शमली की that wave subsides. So most of the time we find that people are obese when they are hungry. They are not hungry for food always. Hungry for love, hungry for attention, hungry for care, listening. So I think even here is the role of family counseling in obesity, because lot of my obese patients tell me की आमचं ऐकायलाच कोणी नाही आहे, आम्हाला बोलायलाच कोणी नाही आहे, we stay lonely. Kids are alone with their grandparents, and they don't have, their parents don't get time to listen to them. So the wife is cribbing that the husband doesn't have time for her. So this is a major cause for obesity. It's cause and effect both. So yes, please.
There are no grandparents today. Grandparents are suffering alone, then children are suffering alone. They want their freedom. In the name of the freedom, they are going separate, and they are suffering there with the children, and the grandparents are suffering here. So there is nobody there for anybody. Everybody wants a listener, but there is nobody to listen to.
In fact, Professor Norman Sartorius said that the worst epidemic today is loneliness. Loneliness in crowd, loneliness in the family. They are among people with lot of loneliness on the inner side. So basically loneliness itself is a inner stress. So it is actually a big wave. Loneliness itself is a big wave which every child, every human being is facing every day. Even in amongst the whole crowd, people find them lonely. You see people sitting and eating alone, but that is not only loneliness. They are lonely even in huge families. So that is a big problem.
As physicians, what we do is we prescribe a certain thing to them, not realizing that each individual patient is a different patient. Say boredom, like I said. So in craving management of substance use, like we tell them that okay, you need to stay away from alcohol, but whole evening that man or that woman was drinking. Okay, now we say that okay, you're not allowed to drink, or we say that you need to be off alcohol. Suddenly that whole evening is free. Same thing now you related to obesity. Now, a person who has been eating, like, to fight their boredom, has been eating, that entire evening. And now we are telling them that, you don't have to eat so much. So we have to substitute that activity as something which is more pleasurable, or at least equally pleasurable to eating to them. If we tell them something else and they don't feel, they don't enjoy it so much, again, they're going to go back to eating.
So here comes the role of hobbies. Hobbies, and second important role is purposefulness. I am sure sir will talk about purposefulness, that a person who feels purposeful every day passing purposefully will never feel lonely. So loneliness comes when boredom sets in. Loneliness comes when you don't have anything pleasurable to do, and loneliness comes when you feel that your life is purposeless. So these three things, I think, today people have money, people have power, people have positions. What they don't have is purposefulness. So when purposefulness comes into life, life changes for them, and then they don't feel hungry. The hunger is gone. The satiety comes into picture.
One more thing is that that's why in mind body medicine techniques, you should have a platter, because one technique cannot work with everybody. So we should have different kinds of techniques available with us. You sometimes it is to be trial error method that you have to, like in medicine also we do that. You do the trial error in dose adjustment. Similarly, for all these techniques, you have to expose that person to these techniques and let the person decide that which is the most pleasurable activity for that person. So that's why one single technique never works. Platter of techniques, yes, definitely it something will fit with that person.
Yes.
Say a yogi person, and I tell him you start trekking every day or going for a marathon, I'm sure he'll not enjoy, and it's not a pleasurable activity for him. And vice versa, if a marathoner, I tell them sit at one place and do meditation, I'm sure that that person is going to keep on thinking of something else. So I think each one needs to identify what their hobbies are, what gives them pleasure, what Dr. Shivram mentioned yesterday. I like that word, the immersive feeling. That immersive feeling is so essential. So you having one immersive feeling for at least 5 to 10 minutes a day. It may be cooking, it may be cleaning, it may be drawing, painting, writing, talking, listening, telling, whatever. One immersive feeling a day, and it works a long way. So I think that this forum actually is utilized for our wellness also. So we have been doing this for past few years, and I can assure that because of sir, my own wellness has improved. So drowned, yes. We are completely drowned. So the immersive feeling is, and I'm sure that everybody here senses that pleasure that we have. You must have attended a lot of workshops, but the pleasure that he has done a very busy workshop yesterday. He's very tired, but he's still with the same enthusiasm he's doing it today, because he's immersed into that activity. So it is purposefulness that gives us that energy. So I think that it has helped all of us, and I'm sure if it has helped us, it will help everyone. So everyone who has come for the workshops, it's not only in Pune, it's worldwide. It is, we have done one in Germany, we have done one in Chandigarh, we have done one in Calcutta, and all these places, the experiences have been same. It has been, so it is a common human base. It is not different for anybody. It is same for class 1 workers, class 4 workers, for mama maushis. So it is a human basic nature that person wants to be heard, person wants to do pleasurable activities, a person wants to do what gives purpose to their living. So these are the three things which actually work. It is not money, it is not position, it is not name, not fame. It is these three things which gives real meaning to life. And I think sir is better person to tell you about this.
Yes, and if you people are interested, there is one very interesting book. The name of the author is actually very difficult. It's a Hungarian origin person. So the name is Mihaly Csikszentmihalyi. So very difficult spelling. But this person is one of the father figures in the whole positive psychology movement, and written a book called Flow. What she just spoke about, this immersive thing. She has written that that if you are in this state of immersion, absorption, pleasant state, instead of an unpleasant state, you are in the state of flow. So the name of the book itself, it's a bestseller, one of the bestseller books. Just few years ago he passed away, but he's a very, yes, the flow, correct. So she just found it instantly, you can find nowadays. So Csikszentmihalyi's entire work is about this, that if you are able to find healthy means of flow. So let us put it this way, that sedentariness, screen time, food, they are unhealthy means of flow. Person gets a kick out of it, but it has a health consequence. It can be replaced, substituted by means which are healthy. Immersion in our daily work, purposiveness, which we really like, for most people, he has said, and it has actually been said thousands of years ago also, that the commonest flow inducing thing for a common man is the Karma Yoga. Our daily activity, if we love it, we can really be immersed in it, and it provides us with sufficient thing. Now we have a broader concept, than the food satiety. The broader concept is called as a psychological satiety. Yoga already had this simple concept called as santosh or contentment. Psychology took time, to catch up with this idea that we need a broader, contentment in life. Psychological satiety, which is, you can say, even level higher than the hunger or satiety for food. Food satiety is a part of, that overall satiety. So if a person has a satiety in life, then satiety is the natural gyro or the natural break, onto that hunger. Otherwise, as Vaishali madam said, that why, so many people, not only from biological background, but from social science background, they started, because globally currently we are in the midst of an pandemic of obesity. So people are wondering, that how come suddenly all the genes, obesogenic genes got triggered, or is it the obesogenic environment, as she said? And yes, perhaps actually lack of psychological satiety. So people are, you can say, not depressed, but they are psychologically hungry. In Hindi and Marathi, it is called as a atrupta atma. Like people are not experiencing a feeling of trupti, despite having, the globally that way, if you look at it compared to say 60, 70, 80 years ago, all over the world today we have a more prosperity by and large, isn't it? Even if we compare our own country where it was 70, 80, 60 years ago and where it is today, we have much more prosperity. But perhaps with our, modern times, what is rising is this atrup. Sort of generate this satiety for oneself. So therefore, one has to think within this broader mind-body framework, to look at this problem, rather than looking through the traditional narrow lens of medicine. We need to look at it in a broader perspective. Then we perhaps are able to understand our patients in a better way. So rather than just saying that is this person hungry for food, the broader question is that is this person hungry in life? Is there something, which this person is missing in life? And wherein, which that need they are trying to fulfill by this particular means. And once we are able to, look at this question in a simple way, I think by common sense, we are all simple psychologists. We don't need some rocket science level psychology to understand, this idea. Once you got this concept, that we are looking at, this phenomena called hunger versus satiety on a higher psychological plane itself, and the food being, one of the ingredients of that. Madam.
So basically, as doctors treating obesity, we need to generate some mechanism of having flow in our patients. So there is a need, when we are talking about history taking, there is a need of psychological history taking and some probing into, at least your educator can probe into what gives them pleasure and what can help them generate flow. So this can be a very good way to get them off their hunger, and they can actually control their gyro gets strengthened up when flow comes into picture. So their hedonic controls are better, their reward system works better, so they get rewarded by the flow activity, and that reward itself, once you are rewarded with the other thing, suppose painting rewards me, I am not going to look at food. So that is how it works. So it is not you don't eat food, but you do this, so it will reduce your food intake. That is the way it will go.
You can do this simple awareness exercise. On a particular day, you ask yourself how much content I am consuming. You look at it. Now, very often, people have found that when people are really happy, that they eat less. Happy people eat less. That happiness, because they are content. I am not just talking of ordinary happiness, but if they are content, they eat less. The very need for having food is because they are full. That is what the feeling of santosh is, that you feel full.
No critical care person person over here. But
Yes.
if you see the difference, I happen to have endocrinologist and critical care consultant simultaneously, and if you see the plate difference between the two, you'll come to know how stress works and what kind of a satiety is. I don't want to blame any specialty, but the degree of stress and the degree of you can say pressure that they have counts on their food intake. So it is not that they are excessively more hungrier than the endocrinologists are, but nevertheless the contentment, that anger, that stress and that cortisol really works on the food and appetite for them.
And finally, this one you explain. This one.
You do. You do it better.
Everyone knows this. What is this? What is this one? Yeah. So now within this our whole paradigm of gyros, turbulence, waves. Where does this whole coconut thing fit in?
You want to say we are nuts?
काय म्हणलं?
You want to say we are nuts?
Coconut, remember, is the most intelligent, of all the beings. Has really learned the art, to sort of remain afloat, flexible, afloat, opportunistic, zero expenditure of energy, zero stress, zero expenditure of energy, just floating, in a societal state, happy that good things will happen, isn't it? Coconut just exists, in a kind of a nice way.
And whenever it gets the place, वो वहाँ पे
It
जाके
germinates.
grow हो जाता है.
It grows. So one of the most intelligent, you can say, you can say coconut tree. You all have seen. We live in of course, she also must have seen. Pune, after all, is close to coast. All of you have seen coconut trees. Most resilient trees, isn't it? They are braving actually the winds and the rain, everything. You never see, coconut trees coming down easily. Even very old coconut trees are also, really standing tall. So they brave all kind of things in life, and they have all these, sort of qualities. So they do it in a very smart, very intelligent way, very invisible. There's no flashiness in it, isn't it? There is no gyro, no riding the wave, nothing. But ultimately they survive. They can, coconut can travel hundreds of kilometers also, hundreds of miles in the sea. They can go, places, and they just wait, for the right opportunity to germinate again, don't expend their energy. So these are all the, you can say even more inculcated, higher level kind of an intelligence, into this kind of a behavior. Kya? Sorry? More evolved. Absolutely, more
कोकोनट
evolved.
बनना आसान नहीं है.
Coconut बनना आसान नहीं है.
हाँ है, लेकिन being us as a coconut, it's most difficult.
So let me put it in the obesity perspective, that being a coconut has two meanings. One is relaxation is very important, as is exercise, as is nutrition. So we have a triangle of diet, exercise and lifestyle management, but we never put a quadrangle, we never put relaxation. So relaxation and just being without thoughts, being without actions, being without thinking, being without seeing your phone, being without seeing the TV screen, and as sir said, closing the eyes. We have never learned that. Even now, this is more for our wellness. So we as doctors need to know when you want to be a gyro, when you want to be a coconut, and when you want to ride the wave. So most of the times when we have a patient who is a gyro, we try to rather patient who is a coconut, you can say, you try to be a gyro and you try to fight that, and vice versa. So the common problem is there's a lot of loss of energy. So you need to identify what category your patient is. Is he a coconut? Is he a gyro? Or is he a person who is riding? You need to change your strategies accordingly. You can't advise a coconut person to say and you ride the wave and you follow this when you get there. So you will have to design your strategies based on the nature of your patient, and all patients are different. And each patient would have different type of manifestation at different times. So that is one. So doctor has to try and match the gyro or the coconut or the riding the wave. And secondly, relaxation is an important part of NCD because your cardiac muscle also needs rest. So you need to breathe less, you need to have less of heartbeats, you need to learn to improve your parasympathetic system. So if you don't do that, you are not going to help in treatment of obesity.
And as you would have heard, last 2-3 days, not only the psychiatrist, not only the neurologist, but today even the cardiologist said that amygdala is hyperactive in obesity. Amygdala hyperactivity tells you what? That the person is not relaxed. Amygdala stands for stress, amygdala stands for, the so-called negative emotions. That is when the amygdala is active, we know, isn't it? The moment there is a relaxation, the whole sort of stress goes away, because relaxation and stress cannot coexist. Okay? And in recent times, on day one also I showed very now strong evidence, that the amygdala activity correlates in a very significant way with the visceral adiposity. And today, Bahel sir, he told us, that it is basically the visceral adiposity which is the pathological. Nahi kya, sir? It is the visceral adiposity which is pathological. So amygdala activity, as she said, the fourth part. So this is what the coconut is. Coconut is very relaxed, really not really worried, not trying to exert, not trying to even fight back. The most kind of smart but very difficult, kind of to achieve and attain. This is the finally you can say is actually the ultimate purpose in the so-called learning of yoga. Relaxation in action. You are active, but you are relaxed. So you are active, but you are not, overly aroused, overly in sympathetic drive. So you are active, but you are happening in a relaxed way.
And you have to,
Recently, interestingly, we generated, this evidence. It is in a publication process in the Frontiers of Neuroscience. It's a good high quality journal where we tried to put this, that even when a person is doing a standing asana, he can still generate, parasympathetic modulation. Normally, the rule is that when you stand up, it's an orthostatic challenge, sympathetic system is activated, but a trained person, a person trained in yogasana can generate. I was sharing, just now with Chandradra sir, a standing asana like Veerbhadrasana, which people normally think is something very activating asana. So person is active, but completely relaxed. Relaxation in action, that is something is like a next sort of, level skill. But think therefore, as Vaishali madam said, in a broader context, not just, in terms of calories, but think in terms of, this broader context, what we now call as an adaptation failure. In the world in which we live, are we really adjusting well, or we are somewhere, failing in our adaptation, and it is manifesting in the form of these NCDs. And obesity, which comes as a mother of that all, is the first indication that we are maladapting. We are not adapting well to the internal and external milieu, and that starts, manifesting in this form and further, translates in more illnesses. Thank you so much from my side.
Sir,
I think
purposefulness is the last thing that I want you to.
So of course, purposefulness.
Just give me one moment,
yes,
sir.
you talk about that.
I was talking about we need to identify which category our patients belong to. So if you have a coconut category patient with you, you cannot expect that you will advise a rapid exercise technique or a running technique or a cycling technique. There you'll have to go into the meditative techniques to get that kind of a. So that is one thing which has really helped me. I can identify that this is a coconut category person, this is a person who will be surfing. So I cannot give you a meditative technique because I know you are a marathoner. So I know that patient is this category, and what is happening is we are prototyped into giving exercise kara, diet kara, 30 minutes chala. But you cannot tell that to a coconut person. I know he's not going to do. So I think it helps us both ways. It helps us to go into different roles. So we can go into a gyro to a surfer to a coconut role for our well-being. And you need to identify your patient as to what is the right technique for you to be advising. Of course, a good clinician is already skilled at that. But I feel that this is a easier technique that you classify them. So you don't break your head on the person saying that you start running. You understand? So that is the way I look at obesity. Yes, sir.
Last one. Thank you. Last one. So about the purposefulness, nowadays another topic which is in vogue is the so-called physician burnout. Like a lot of people are also researching that why doctors are burning out. And of course, a lot of other professionals are also working out. Doctors are also humans. They are also working out. And interesting research behind all that, the some so-called lower animals are happy, because they are completely automatically driven. Like we say, that they are driven by instinct. Lower animals have instinctual behavior. They don't try to unnecessarily think about life too much. Isn't it? They spend life on a day-to-day basis and in the end they are happy. The tragedy with human being, because of this brain so-called, 20% energy guzzler, is that it puts us, in what Shakespeare described in Hamlet, in the Hamlet, and not in the helmet, but in the Hamlet play as to be or not to be. So the main problem with human being is human beings, they mostly exist in a state of confusion, because of the pressure of, now you understand, this default state, which is driving you into some automatic behavior. And on the other hand, you have, certain aspirations. So a human being is internally pulled, into different directions, and it's a bit sort of a confused creature. Now, the so-called purposiveness is something, about reflecting on life, that on different stages and steps in life, what is it, that I'm really interested in? Because if somehow we are able to help ourselves out of this confusion and have some clarity for ourselves, into the direction that we want to, which really we like, to take in life. So that directionality is the so-called the purpose or the meaning, something which then I find worthwhile working on, and around which I am able to overall, keep all my confusion clear. So clarity, and that's what people call very often as wisdom. You also listen nowadays, isn't it? That we live in an age of information where people have become very well informed. People are extremely knowledgeable. But a lot of people are also arguing that is our wisdom going up or is it coming down? Are we becoming more knowledgeable but less wise? So being more wise is, about understanding ourselves and trying to, understand this phenomena that we need to do this shepherding. That we are literally like a herd of sheep which needs a direction. And that is what actually that purposefulness is about. And people have done very elegant research where they have shown that if people have, this feeling of meaningfulness and purposiveness and some degree of control on their lives, their overall health outcomes are, much better. In fact, that was the beginning, you can say, of so-called positive psychology. They found that in addition to the, conventional risk factors, what determines actually the outcomes is this one important factor, purposiveness, optimism, hope, very, otherwise they are considered as very so-called soft things. Sinkar sir, cardiologist, he will say that compared to, all the hard risk factors, this is all considered as a very soft risk factors. But in the end, you find that they are playing a very important role. Not only are they playing important role in cardiovascular health, but they are playing important role in a life being meaningfully spent. Otherwise, a very influential developmental psychologist, Erik Erikson, he has called that after midlife we have a possibility to, end up into what is called as despair. Integrity versus despair. Integrity means that I attained something in life and I'm content with it. You have a feeling of satisfaction, feeling of integration. Versus despair means we already talked, that atrupta atma. So sometimes the atma is atrupta because it does not know, what it is looking forward to. Is it chasing money? Is it chasing power? Is it chasing relationships? Is it chasing whatever, So if we are clear about that, then it is possible, for us to attain that contentment and that closure, psychologically we call it as a closure, integration. Otherwise, we end up having worked very hard as people in desperation, integrity versus despair. And that despair situation also, we see a lot of people around us. So people, those who are not, they have everything else but not really happy. So therefore this very variable, Vaishali madam said that many of these things, as much they apply to our patients, they equally apply to us, as human beings. Many of us here in this room, we are definitely middle-aged, if not older. This also should give us, this opportunity to think about it, that what is something which brings meaning to me in my life, which I find purposive. Am I able to integrate, all that I learnt in my life, not only in the books, but, my life has taught me some experiences. Am I able to put it all together? Am I wiser today, compared to where I was 10 years ago or 20 years ago? If you have that, you can experience, that feeling of santosh and satiety. And of course, I think every human being, ordinary mango person should be able to experience, that feeling of satiety. We don't really need to be exceptionally brilliant or exceptionally intelligent. We just need to be smart, to be able to do that and learn, translate, all this nice neuroscience research into our practical lives. So thank you so much. Great pleasure. I will play one song. I will play one song.
So we end with that song because it's my favorite one. So yeah, so I feel good when I hear that song. And when it ends my day, I think I have achieved it. That's what I get, yeah, as a feeling. So I think that even if it helps at least half the crowd over here, I'm satisfied. So it's a purposeful thing for me. So I think, sir, credit goes to sir that he has introduced me to this song. Sir has huge collection.
कुछ दिल ने सुना कुछ भी नहीं ऐसे भी बातें होती हैं ऐसे भी बातें होती हैं कुछ दिल ने कहा कुछ भी नहीं लेता है दिल अंगड़ाइयाँ इस दिल को समझाए कोई अरमान आँखें खोल दे रुसवा न हो जाए कोई पलकों की ठंडी सेज पर सपनों की परियां सोती हैं ऐसी भी बातें होती हैं ऐसे भी बातें होती हैं कुछ दिल ने कहा कुछ भी नहीं
Listen to the second part very carefully.
दिल की तसल्ली के लिए झूठी चमक झूठा निखार जीवन तो सोना ही रहा तुझसे भी बातें होती हैं, कुछ दिल ने कहा कुछ भी नहीं। कुछ दिल ने सुना कुछ भी नहीं।
Beautiful and philosophically very deep song, isn't it? Huh? झूठी समक, झूठी चमक, झूठी चमक, झूठा निखार, दिल की तसल्ली के लिए, टू प्लीज अवरसेल्व्स, झूठी चमक, झूठा निखार, कलियों से कोई पूछता हंसती है या रोती है. So I think that is what is happening, unfortunately, to modern humanity. Na? We said prosperity increases, but behind the jhuti chamak and jhuta nikhar, somewhere the inside of us is crying and craving. Yes. Facebook and Instagram. Exactly. Jhuti chamak, jhuta nikhar, and the inside of us is crying and craving. Virtual reality. Good. So it was a tremendous pleasure. You are a group of extremely wise people. Applause for themselves. You have been very wise people. From every workshop, we learn a great deal. There are intelligent people, very intelligent responses, and it's there for a enormous pleasure for us. So wonderful. So next time, listen to music, listen in two ways. So one is that pay attention how your brain reacts to a particular music, okay, like you saw today. And second is that some of this retro music, so-called, has very beautiful and very profound, sort of a poetry in it. So like just yesterday in that workshop to students, we are showing, that Sonu Nigam song, Kabhi Dhoop Kabhi Chhaon wala. हर घड़ी बदल रही है रूप जिंदगी, छां है कभी, कभी है धूप जिंदगी. Profound poetry, but normally we may otherwise miss this one. क्या बोला यार?
One song which I find very soothing, and dilemma होता है तो सुन लो, मैं जिंदगी का साथ निभाता चला गया. That's an amazing song. उसका एक एक word is so much wisdom in each word.
सर भी अगर गाने सुनेंगे तो उसी पे हो जाएगा वर्कशॉप हमारा.
एक होना चाहिए सर म्यूजिक पे.
गम और खुशी के बीच फर्क न महसूस हो जाए.
That was amazing.
मैं दिल को उस मुकाम पे लाता
चला गया.
Salience network.
योगी.
In yoga it is called as Tato Dvandva Anabhigat. I rise above the polarity of happiness and sadness.
And one more thing he said, why should I only celebrate the successes? I will celebrate my barbadi also. Yes. Barbadi को भी मैं जश्न मनाना चला गया. Amazing. It doesn't affect.
सर का फेवरेट गाना. लास्ट टाइम तो सुनाया था. एक्चुअली हमारे राइटर्स थे या जो म्यूजिक डायरेक्टर हमारे म्यूजिक राइटर्स.
मैं जिंदगी का साथ निभाता चला गया, हर फिक्र को धुएं में उड़ाता चला गया, हर फिक्र को धुएं में उड़ा. बर्बादियों का सोग मनाना फजूल था, बर्बादियों का सोग मनाना फजूल था, मनाना फजूल था, फजूल था, बर्बादियों का जश्न मनाता चला गया, बर्बादियों का जश्न मनाता चला गया, हर फिक्र को धुएं में उड़ा। जो मिल गया उसी को मुकद्दर समझ लिया।
दिस इज कंटेनमेंट, दिस इज संतोष। जो मिल गया उसी को मुकद्दर समझ लिया,
जो मिल गया उसी को मुकद्दर समझ लिया, मुकद्दर समझ लिया, मुकद्दर समझ लिया। जो खो गया मैं उसको भुलाता चला गया, जो खो गया मैं उसको भुलाता चला गया, हर फिक्र को धुएं में उड़ा। गम और खुशी में फर्क न महसूस हो जहां, गम और खुशी में फर्क न महसूस हो जहां, न महसूस हो जहां, न महसूस हो जहां। मैं दिल को उस मकाम पे लाता चला गया, मैं दिल को उस मकाम पे लाता चला गया, मैं जिंदगी का साथ निभाता चला गया, हर फिक्र को धुएं में उड़ाता चला गया।
people say that Sahir Ludhianvi was a very communist thinking person, but I think he was a great yogi who had understood actually the Yoga Sutra in a very profound way, who had understood actually, the yoga in a very profound way, because as you saw in this song, it's completely based on, the ideas which we just spoke. So the person says that जो मिल गया उसी को मुकद्दर समझ लिया. Yes, it's by Sahil Ludhianvi. That is what contentment is. जो मिल गया उसी को मुकद्दर समझ लिया. And then there is another idea in yoga, another niyam called a shauch. Shauch is not only physical. Shauch is psychological cleanliness also. जो खो गया मैं उसको भुलाता चला गया. So niyam, so the two niyam, santosh and shauch, he is talking in this, and in the next stanza even more profound. गम और खुशी के बीच फर्क न महसूस हो जहाँ, मैं दिल को उस मकाम पे. So I train myself, to a way where the pain and pleasure are no longer hurting me. Is the tato dvandva anabhigat, is the fulfillment of yogasana. क्या? Correct. Exactly. Good. So yes. काय आहे का काही फरमाईश तुमची सांगा. We already ते लावले शकणार. Yes, sir. Serenity. Serenity is the feeling of psychological satiety, psychological fullness. I am full. Serenity is I am full. Peace. I am at peace with myself.
Tranquility.
I am at peace with myself. Of course, outside world, inside world, no friction, ahimsa. Serenity is a byproduct of ahimsa. Hinsa is a product of friction, when there is no friction, smooth situation, that produces this feeling of serenity. So serenity is a sort of a, sorry?
People understand serenity or
No. That is apathy, she will say as a no. Yoga is relaxation in action. Yoga is not relaxation in inaction. Yoga is relaxation in action. You are fully active and yet you are relaxed. You are not inactive and relaxed. Okay? That's why progressive muscular relaxation is a relaxation in action. Yogasana is a relaxation in, you are doing an action, but you are relaxed. It's just like a case example. As an example, Yogasana has been provided that you are doing a physical activity, but you are relaxed. So this is paradoxical, in some way it's paradox. Can you be relaxed, when you are active? So the yoga's answer is yes. Because the answer is you can mix the default state and the executive attention state in such a way that the flow happens, as Mihaly Csikszentmihalyi has said.
So thank you, sir. Thank you for that excellent
Okay.
deliberation, and I think everybody is looking peaceful and tranquil.
Yes, peaceful, tranquil, serene.
Yeah.
Nobody wants to get up.
This
This is flow. This is flow.
This is what is a uniform experience. Whenever we have
Yes.
done the workshop, we were the ones to go out first, not the audience. So
No, and this skill, because Shankar mastered, that's why it's called as Gangadhar. Because as you know the mythology, when the Ganga came flowing, it was extremely turbulent. And there was a fear, that the Ganga may wash the earth. The whole earth may get washed out. The whole earth may get washed out, isn't it? Because the flow was so much, turbulence was so much. So what Shankar does it, that it contains it, At some point, what he said, when it comes to Kashi, the Ganga becomes serene. There is a flow, but it looks still. So having a flow, but giving a feel of stillness. Prashanta Mahasagar, that's why in yoga also, Prashanta Vahita, the idea is Prashanta Vahita. Is the serenity, that there is a flow, but it looks almost like stillness. That is what the serenity is. So therefore, Shiva is also called as Gangadhar. So the default state, maybe, at that time, that was an easy way to explain to people that we all by nature are gifted with this default state. We have to learn this skill. We all have to become Gangadhar, not just praise Gangadhar, but we have to become Gangadhar and need to know how to regulate, this kind of an energy of nature into this Prashanta Vahita. So that is a learned skill which we have to kind of
the
work
tragedy
on.
is that this needs to be taught as early as in life. So either we teach our children or our school teachers teach their children, or instead of having moral science lectures, learning to skill this art of improving mental resilience through these techniques. And that's why yoga is being now taken up into schools, but people take yoga as exercise.
Unfortunate part, either it is
Yeah.
taken as exercise or it is seen as, some part of some spirituality, so
Or religion.
which is not, it's a part of, you can say, a very
Mental
neuroscientific
training.
approach to cultivation of mind. And of course, by an extension, cultivation of our own life itself.
So I think we have to start our day tomorrow again at 9. So I have to come back to the reality. But tomorrow we
Yes.
have another interesting session by Leena Madam. Now
Yes.
we heard the theory of yoga and theory of how mind regulation is so important, because mind is like a turbulent flow of river, and
Yes.
this turbulence is day in and out.
Becoming Gangadhar. So tomorrow's
So between two
session title is
Gangadhars,
Becoming Gangadhar.
so how to really work on it practically is what Leena Madam is going to do. She has been helping our patients. Our patients are very happy with the techniques that she follows. She has simplified it through yogic methodology, and it is an amalgamation of neuroregulatory techniques using yogic techniques that she's been going to teach tomorrow. So thank you all, and tonight, the dinner will be a la carte in case. I think the high tea is served outside, if I'm not mistaken.
Good.
Is it? Yeah. So
Great
we
pleasure.
welcome all you for the high tea.
Thank you all.
Yeah.
Very great pleasure.
Thank you.
You all.
All said and done, sir. Everybody in this room will always remember you whenever we put on the music.
So we meet tomorrow at 9 o'clock in the morning over here. Tomorrow we have more of a body session. So we will be having musculoskeletal health, and we have a very interesting Dr. Namrata who takes a very good session on physiotherapy and muscle building and muscle training. So she helps us build up the body. We have heard about the mind, and Madam is going to take neuroregulation, how to control that mind through body techniques. So this is what we are going to learn tomorrow. So please don't miss tomorrow.